What does my dog mean to me?
What does my dog mean to me?
What does my dog mean to me?
They mean a lot to me.
There's like a special place that she fills.
They're the calm in the storm.
My dog means the world to me.
He's the first thing I see when I wake up in the morning.
They're the reason I come home. They bring such joy.
Companionship.
It might be cliche, but he's just my best friend.
He's like, hey, life's short. Let's go play.
She's loyal. Very loyal.
It's that indescribable connection that you have.
Unconditional love. You don't get that from anybody else.
My dog means heaven to me.
To me, it's the biggest. Whenever I'm actually looking at a client and I can honestly say, this is what I would do for my pet. We're truly trying our best to make sure that we give them the education, the knowledge, the understanding that they can make good decisions about their pet's health care. What do my pets mean to me? My pets are more of just the completion. As a family, I think we all just enjoy being able to curl up with them and, and run through the yard. And so it just seems to make the whole family more complete. This is truly just a love and a passion. Just enjoy it.
When you get accepted and you get to training camp, your life is really about to change.
What it gives is Trey the peace of mind of knowing he's not by himself, me the peace of mind knowing that Trey's not by himself, and he's just whatever we need him to be, that's what he is.
Because of the progression of the disease, I'm so glad that we bonded as quickly as we bonded. I was fortunate enough to get her sooner rather than later, and it made such a difference.
It's just amazing what these dogs can do, how smart they are, the love that they have. I'll get emotional in a minute. I don't want to cry. She's probably one of the best things that's ever happened to this child.
The way she really works for me is she changes the conversation. The whole getting to know you process. You're not defensive. Why is somebody trying to get to know me and ask first, why am I in a wheelchair? Hey, that's the biggest thing. And when you change the conversation, it makes you want to go out and explore more, so it adds to independence.
When the dogs look up in their person's face, they don't see somebody who uses a wheelchair or has a disability. They see the most perfect creation God ever put on the earth. And it changes the way you feel about yourself. And to think that there is a big corporation like Elanco that would come in and say, we care about you and we want to help you change the world for people and for dogs, for every single person who works with this company. I give you my heart.
What does my dog mean to me? She's a companion. I lost my wife about 3 years ago, and at the time, she really was my wife's dog. And when she passed away, the day that I brought Tippy home and went into the house, she's racing from room to room looking for her mom. And but over the years, she and I have become so close that she's filled all of the empty spaces that I lost several years ago. And so I guess that's pretty much what she means to me.
What does my dog mean to me? Oh, there's like a special place that she fills. I have a dog named Casey, who's like this little lap dog we've had for many years now. I think she's like 13. When we first met her, it was like, she just became just like an instant family member. She just likes to cuddle, that's what she does. And we sing together. We do. I come in, normally what I do is I'll come in, and if Casey's been at home alone for a bit, I come in and she gets all excited and she goes right to the couch and she gets up on the thing, and then we go, and we sing, and then we cuddle for a second, then we sing again. So she does it for like usually, you know, a good 5 minutes. I go back and forth. If my wife and kids are there, they're like, Dad, stop, because it gets pretty loud. So yeah, she's sweet. She's a very sweet dog.
I've got 2 dogs, we've got 3 cats, we've got birds, fish. I consider myself an animal person. Yeah. Abby, my boxer, she follows me everywhere. If she could be that little teacup poodle size, she'd be on my lap if she possibly could. So she's my favorite just because she kind of has pushed herself into my into my heart. They're just a part of the family. I mean, they're part of our lives. I mean, I couldn't imagine going home and not having the dogs there to greet me. We all are just drawn to being around animals and helping them. I mean, working in a vet clinic, it's fun. It's fun. It's fun seeing these animals grow up. It's fun seeing these people and how much they love their animals. It's fun.
What does Miss Skipper mean to me? She means the world to me. She owned me the minute she jumped on my lap, and I met her. That was the telling point right there. Well, I have ALS, which is Lou Gehrig's disease. The disease continually progresses. It's a neuromuscular disease where your nerves disconnect with your muscles. I tell you, I don't know what I would do without her. Anything that I need, she is there for me. She's my best friend. She is my companion. My wife gets jealous, I guess, because she thinks I love the dog more than her. So I have to be careful.
I have a beagle named Cindy. She's 12 years old, and I got her actually as a present for graduating college. I noticed that my mom had something in her hand, and then my mom hands Cindy to me. I knew, like, oh my God, like this is my dog, and my mom said, I'm not gonna be with you, but she will be, and handed her to me, and she's been with me ever since. When you first leave home, it's scary, and Cindy gave me that comfort.
What does my dog mean to me? Everything. She's love and she's acceptance. She accepts me on my good days and my bad days, and she's got my back. I have a golden retriever. Her name is Buffy, and she's about 13. Well, we think she's 13 because we adopted her when she was about 2 or 3. Found her in a pumpkin patch. You know, if you have a bad day, she's like, hey, Lee, what's up? You know, I mean, and she attracts people. They'll cross the street to come over and touch her. And she's 13. It's not like she's a puppy.
She's
Yeah,
a sprightly
great.
13.
Oh, and she's beautiful. She's red like me, and she's great. Like, you see her and you want to like touch her and pet her, and yeah, she's great. I think we have just a special connection with animals. You know, they kind of like, they can see your soul. You know, they can see through all the stuff we have, our facades, and they see your heart. And you just connect with the right ones.
What does Paisley mean to me? It's hard to find a word. The biggest thing that she provides me, I mean, of course, love. She makes me laugh all the time, but the way she really works for me is she changes the conversation. Before I had her, it was, look at you, why are you in a wheelchair? You know, like, that's not the first thing you would say to somebody. So when I got her, now all of a sudden is, your dog is so beautiful. Or I don't even get the your dog. I just get, she is so beautiful. And I go, thank you so much. I sure am. And you know, it changes the whole getting to know you process. And when you change the conversation, it makes you want to go out and explore more. So it adds to independence. Paisley, Paisley, Paisley. She means, I guess, everything would be the word.
What does my dog mean to me? I've got a special one. His name's Homer. Well, he's my companion. He's my best friend. When nobody does care, he seems to care for some reason. He's just a lab. I mean, some days you think he might have a brain, but then in the end you just know that he really doesn't think a whole lot. It's basically about food. I've got 6 kids at home. And the best thing about Homer is my wife doesn't have to clean the floor at all. Whenever they spill anything on the floor, he's right there to clean it up. I am a vet technician. I've been working with animals since senior in high school. There is a huge responsibility in caring for other people's pets. You know, we have the knowledge, we have the skills and ability to help make these pets better. Honestly, it's just so much fun. There's just no better job than this.
I do have a pet. I have a black lab named Manny. It might be cliche, but he's just my best friend. He's excited every time he sees me, and I'm excited every time I see him. I just became engaged a month ago. And Manny was kind of a skittish dog when we first got him. He kind of was afraid of people. And the first time I took my now fiance to meet him, he ran out of his crate and just went crazy and jumped all over her, and we were so surprised because it's like he had a feeling about her. So last month, I took my fiance on a walk, and with Manny, I didn't take her on a walk, I took the dog with her on a walk. And I made a video, and in the video I had all these pictures of different dates I'd been on with my girlfriend and things like that. And at the end was a picture of Manny making the sad puppy eyes with a little text that said, "Will you marry me?" on it. And that's how I proposed to her. So it was a pretty great day. She definitely is marrying Manny too. Yeah, it's not, she gets both of us. She's stuck with both of us.
2 years old, she started having seizures. Long story short, she has grand mal's, the petite mal's, and myoclonics.
My mom and dad check on me every 2 minutes, calling my name.
Because she doesn't know when she's about to have one. She has no clue. And she doesn't even know that she's had one after she's had one. And I wanted her to be able to do things on her own. This dog right here watches over her like a hawk.
It gives me a lot of freedom when I'm in my room, since Ryder can detect my seizures.
And she needed her freedom to experience life and, do stuff on her own without her mom and dad being there all the time. This is her best friend. I mean, she's wonderful. I'll get emotional in a minute. I don't want to cry. She's probably one of the best things that's ever happened to this child. Oh, here we go. And she's gonna get mad at me. She is something else.
Dixie, she's a senior dog. She's 17 years old. She just turned 17. And she's the love of my life. I mean, she is my daughter. She's a Jack Russell. Yeah, and she never was one of the hyper ones. She's always been there for me. When I'm sad and down, I always can go and cuddle up with her on the couch. When you're a dog person, people know that they're like family. The people who do treat their animals like a family member, I think they get a lot out of it. It's unconditional love. You don't get that from anybody else. That dog is right there, wagging its little tail, ready for you to come home. They are family, wouldn't you say so? Yeah.
What do my pets mean to me? My pets are more of just the completion. As a family, I think we all just enjoy being able to curl up with them and, and run through the yard. And so it just seems to make the whole family more complete. Everybody has that one special one. And mine was the ring bearer in my wedding. I don't know why I'm even breaking up over that. But he was my dog. You were excited. He was excited and wanting to run and play. So he went around everywhere with me for 10 years. To me, it's the biggest. Whenever I'm actually looking at a client, I can honestly say, this is what I would do for my pet. If I can do something that I can try and help somebody actually make their pet better and live longer, I think that's just our job. That's our responsibility. This is the only job that I can honestly say I don't have to work. I mean, I get up in the morning, my family says that I was destined to do this. This is truly just a love and a passion. I just enjoy it.
Wit is, he's a great dog. He's a very loving dog. He's affectionate when you need affection. He's helpful when you need help. He's Trey's dog, and he's Trey's companion and helper and all of that, but he looks after everybody in the family. He likes to know what everybody's doing at home. If I am busy out doing yard work or whatever, he's hanging out in the bedroom with Trey. And that honestly, that was one of the reasons that we got Wit and got him when we did, is because we knew that Trey was going to get to a point where he didn't always want Mom to be sticking around to be the one to help him. Wit allows that to happen. It gives Trey the peace of mind of knowing he's not by himself, me the peace of mind knowing that Trey's not by himself. Trey's very lucky to have good friends, but sometimes they're out doing things that Trey can't do, and when that happens, he's always got wit there for him. And, you know, he's just, you know, whatever we need him to be, that's what he is. And it's just that kind of insurance that, that he's there when we need him to be there.
What do my dogs mean to me? Remus, my Great Dane, we got him when he was a little fella. Little, I don't know if you could describe 30 pounds at 6 months, you know. So yeah, we've had him for 6 years now. There's one thing that he really likes, and that's when he goes for a car ride. So when I have to go do banking or whatever, go to the store, we have a sunroof and his head pops out. He's like a hood ornament. He's huge. People like to stop and take pictures of him at traffic lights. They always ask for my permission. I was like, that's fine, sure. So he's a little popular out on the island. What do my dogs mean to me? Well, they mean a lot to me.
Do you know the #1 reason cat owners bring their cats to the veterinarian? The answer might surprise you, but the clear leader is inappropriate urination outside the litter box. This, as you might guess, creates quite a bit of frustration with owners, and if left unresolved, often escalates into a fractured relationship between the cat and his or her owner. If no resolution comes about, the cat is often surrendered to the local animal shelter. This cycle is unfortunate, but it occurs all too often. Is your cat at risk for developing a urinary tract disease that might result in inappropriate urinary behaviors? Is your cat trying to tell you something with his or her odd behavior? Due to new advances in veterinary nutrition and a better understanding of veterinary behavior, there is great hope for all cats. In this video, we'll give you insight into understanding why cats urinate inappropriately and how to prevent it. Though behavior can be a primary cause for cats to urinate outside their litter boxes, a surprisingly high percentage of these cases have a clear medical or nutritional cause that can often be effectively treated if accurately diagnosed by your veterinarian. Unfortunately, it's often not as simple as giving your cat a pill. Infections are very rare in cats with urinary problems. Therefore, antibiotics are not usually the answer. Let's join Miss Olson and Dr. Thomas as they discuss Tigger's inappropriate urinary behavior.
Well, Miss Olson, we've finished all of Tigger's tests and we've ruled out stones and infection as the cause of his problems. I'm pretty confident in diagnosing with what we call feline idiopathic cystitis, or FIC. That would account for all of the symptoms that you described that you're seeing at home, the frequent trips to the litter box and the straining, the crying, the blood that you saw in the urine, and the frequent licking and cleaning himself.
I'm not sure I've heard of FIC. What is it and how did Tigger get it?
Feline idiopathic cystitis is very common among cats. However, it's one of those disease complexes that's not entirely understood. We do know that stress plays a role, and diet is very important in both therapy and prevention.
Is it serious?
It really is. There's a lot of inflammation that's going on in Tigger's bladder and his lower urinary tract, and that gives rise to a lot of pain and discomfort, which is giving rise to the signs that you're seeing, the crying, the frequent urination. It can also lead to long-term behavioral changes if it's not treated. Tigger might end up learning to go in other places and other locations besides the litter box.
I had no idea this was going on. Now, you mentioned diet earlier. Does it have something to do with what I'm feeding him?
I'm afraid so. What are you feeding him currently?
Well, it varies. Usually name brand foods from the grocery. I do know in the past I've fed some of the ones that were labeled to help prevent urinary disease.
Unfortunately, most of the diets or foods that you would purchase from the grocery store don't have the proper blend of ingredients and formulation to effectively manage all of the elements of urinary tract disease. Some of those that are labeled for urinary disease that you've used would address pH, and that will help with the formation of what we call a struvite crystal. However, there are other elements that it doesn't take care of. I'm going to put Tigger on a great new diet from Hills. It's called Prescription Diet CD Multicare. It's going to take care of struvite and oxalate crystals, as well as the FIC symptoms that he's currently dealing with. It also is formulated with fish oil, which has omega-3 fatty acids. That's going to be important for breaking that inflammation cycle that he's got going and help Tigger to feel better faster.
Hills understands the nutritional needs of cats. That's why more veterinarians recommend Hills' prescription diet than any other food for managing urinary problems. Hills' Prescription Diet CD Multicare Feline has just the right mix of ingredients to minimize excess quantities of magnesium, phosphorus, and other minerals responsible for forming crystals and stones in the urine. This amazing food produces an ideal urine pH and is low in salt. Foods containing excessive salt can promote the progression of renal disease even at early stages before it is even diagnosed. That's important when you consider that kidney disease is one of the leading killers of cats. Hills has also added a unique combination of antioxidants to help reduce cellular oxidation that may occur with inflammatory urinary diseases. Also, the presence of omega-3 fatty acids from fish oils aids in breaking the inflammatory cycle common with urinary problems. Your veterinarian recognizes that other issues sometimes contribute to a cat's inappropriate urinary habits. As a pet owner, you can combine great nutrition with several practical tips that together will make urinary disease less likely. First, know some of the signs of lower urinary tract disease to watch for. Straining while trying to urinate, urinating more frequently, crying out in the litter box, licking around the genital area, lethargy, and occasional blood in the urine. Some cats will also exhibit a noticeable change in their normal behavior. Taking other steps to prevent lower urinary tract disease complements feeding Hills' Prescription Diet CD Multicare Feline. Plenty of physical activity for your cat is one step that helps lower your cat's risk. Another helpful strategy is to provide plenty of fresh water for your cat to drink. This can be accomplished by providing your cat multiple water bowls that are filled regularly. Another way to increase water consumption is to feed canned foods, which naturally contain increased amounts of water. Prescription Diet CD Multicare is available in cans and in many flavors, which may be a convenient option to increase water consumption. Minimizing stress for your cat is also an all-important step that will help in preventing urinary tract disease. You may want to consider creating places to perch away from foot traffic and other pets. Keep the litter box very clean. Many cats will stop using the litter box if it is not maintained by daily removal of feces and periodic changing of litter. Utilize multiple litter boxes. In general, there should be one more litter box in the home than the number of cats. For example, a house with 2 cats should have 3 litter boxes. Most cats prefer clumping, unscented litter and an uncovered litter box. It may be helpful to provide several different types of boxes or litter. This makes it convenient for the cat and also allows them to choose between varying litters in varying boxes. In addition, making changes helps break the negative association of pain with the use of the old litter box. Managing urinary disease goes hand in hand with great nutrition. Hills Pet Nutrition makes it easy with Hills Prescription Diet CD Multicare Feline. Talk to your veterinarian today and see if it's the right food for your cat.
Administration of eye drops, ointments. Your veterinarian has prescribed medication for your pet's eye condition. If more than one medication is to be given, be sure to read the labels carefully for directions. Some medications may be for just one eye, and some may be for both eyes. Directions on the label are written for your pet's right and left sides, not yours. Find a place in your home that is quiet and calm to attempt medicating your pet. Restraint of your pet while administering eye drops is of paramount importance to avoid eye injury. Ideally, 2 people are present for medicating, 1 to restrain and calm your pet, and 1 to medicate. To keep your pet close to you, stand behind their body. You can hold them between your legs. Cats and small dogs can be wrapped in a towel to hold them close while giving the medication. For larger dogs, sitting them in a corner can be helpful to hold them still. Before administering the eye medication, use a warm, damp washcloth to carefully remove any discharge that may have accumulated on the outer portion of the eyelids. To administer the eye medication, raise your pet's chin with your non-dominant hand. Pick up the medication with your dominant hand. Use a finger to gently open the top eyelid. The tip of the applicator should be held approximately 1 inch above the eye. Do not allow the tip of the dropper or tube to touch the eye, as this will cause contamination of the medication. Instill the prescribed amount of medication. If using drops, continue to hold the head in a raised position to allow the medication to spread across the eye. If applying an ointment, gently close the eyelids to allow the ointment to cover the complete surface of the eye. Praise your pet when you are done. To ensure the best care for your pet, carefully follow the directions prescribed by your veterinarian. You need to call your veterinarian if 1. You are not able to administer the medication at home. 2. The eyes become red after administering the medication. 3. Any eye discharge worsens or does not improve within 24 to 48 hours. 4. Your pet begins squinting. 5. Your pet appears painful. Allergies and your pet. Just as people have allergies, your pet can suffer from them as well. An allergy is an abnormal response by the body's immune system in reaction to an allergen. Allergens are foreign proteins that can be absorbed through the skin, inhaled through the respiratory system, and ingested through the gastrointestinal tract. Allergies in pets manifest in a different way than they do in people. In people, the primary signs of an allergy are runny nose, sneezing, coughing. In pets, the most common allergy symptoms are associated with the skin. Allergies are an inherited condition that often begin when pets are young, around 1 to 3 years of age. Your pet may experience seasonal allergies initially, but often the allergy period extends and may become year-round as your pet ages. Allergy-related skin reactions are characterized by redness and itching, particularly involving the face, ears, feet, armpits, and abdomen. The inflammation on the skin, caused by the allergic reaction in the body, will make your pet susceptible to developing ear and skin infections. Diagnosis of allergies can be complex and begins with a thorough history and comprehensive physical examination. Your veterinarian will discuss with you specific tests that can be done to check for skin infections and aid in the final diagnosis of allergies. For allergies that are severe and/or year-round, diet therapy and allergy testing may also be considered. Allergies are a lifelong condition. There is no cure for this, only the ability to control it. Treatment for allergies involves a combination of medications to provide relief, antibiotics to clear infections that have developed, antihistamines to decrease the allergic response, fatty acid supplementation to reduce inflammation in the skin, and medicated shampoos and sprays for topical therapy. If these medications do not provide relief, your veterinarian may talk with you about immunotherapy, also known as allergy shots, and/or specific diets to address a food allergy. Be sure to contact your veterinarian if your pet's condition is not improving. Allergies can be challenging to treat. Your veterinarian will work with you to provide a treatment plan that can help your pet be more comfortable. Administration of injections. Your veterinarian has prescribed a medication for your pet that requires an injection. While the thought of giving injections may sound intimidating, with guidance and practice, you can do it. Read label directions closely to ensure proper dosing. The medication should be drawn up into the syringe according to the directions given to you by your veterinarian. Keep the cap on the syringe until you're ready to give the injection. Once the syringe and needle are ready, call your pet to you. Allow your pet to settle into a comfortable position. Ideally, injections are given with 2 people. One person to distract your pet while the other person administers the medication. Once your pet is calm, remove the cap from the needle. Once the cap is removed, do not set the needle and syringe down, as this will cause contamination of the needle as well as pose a hazard to you and your pet. While standing behind your pet, use your non-dominant hand to grasp the skin near your pet's shoulder blades. Tent the skin to form a pocket to inject into. With the bevel of the needle pointing up, slide the needle under the skin quickly and carefully. Pull back on the plunger to verify that you have negative pressure and that no blood is seen in the syringe. If you pull back on the syringe and it fills with air or blood, then you need to remove the needle from the skin and try again. After verifying that the needle is under the skin, inject the contents of the syringe as directed by your veterinarian. When done giving the injection, dispose of the needle and syringe into a designated sharps container according to your local regulations. Contact your family veterinarian if you have any questions regarding your pet's medications. Praise your pet after the injection. Give yourself a pat on the back too for a job well done. Anal sacs, also known as anal glands, are 2 scent glands located on both sides of the anal region in dogs and cats. The anal glands form secretions that are for scent marking purposes only. In the domestic dog and cat, the glands serve no functional purpose. Normally, the anal glands empty daily. Pressure from a bowel movement causes anal gland secretions to expel as the feces exits the body. Anal glands may become inflamed if they do not empty normally. Common causes for the glands to not empty include excessive fat deposition around the glands, history of soft stool, and dietary changes. Contrary to popular belief, intestinal parasites are not a cause of anal sac irritation unless the parasitic infection has caused soft stools. The distension of the anal glands can cause great discomfort to your dog or cat. In an attempt to relieve the pressure and pain caused by the enlarged anal sacs, you may notice your pet having difficulty passing stool, licking or chewing its tail area, or scooting their rear end on a rough surface. Mild anal sac inflammation may be treated with manual expression of the anal glands only. Moderate inflammation may require that the obstructed ducts be flushed using a small catheter so that medicine can be directly administered into the inflamed glands. Chronic anal gland inflammation can progress to an infection. When infected, the glands become occluded, causing a painful swelling on the side of the anus. As the infection matures, an abscess may form and rupture through the skin around the anus. If the inflammation has progressed to an anal sac abscess, immediate veterinary care is necessary. To treat an anal sac abscess, surgery may be required in combination with antibiotic and anti-inflammatory therapy, as well as pain relief medication. In cases of chronic infection, surgical removal of the anal glands may be recommended. Your veterinarian will provide recommendations to prevent and control future anal sac problems in your pet. Basic ear cleaning and medicating. Cleaning your pet's ears is a necessary part of grooming. The frequency of ear cleanings varies from pet to pet. Pets with no underlying ear problems may only need to have their ears cleaned after a bath. In contrast, pets with ongoing ear inflammation may require more frequent cleanings. Before we look at how to clean the ears, let's look at the inside of your pet's ear. In the external canal, there are two parts. The vertical canal. This is the area that you can see from the outside. The horizontal canal. This area is typically not seen from the outside without the use of special equipment. During routine ear cleaning, this is the portion that is cleaned. The eardrum separates the external canal from the middle ear. Beyond the middle ear is the inner ear. Routine ear cleaning does not involve the middle or inner ear regions. Prior to cleaning your pet's ear, lift the ear flap and visually inspect the inside. Inspect your pet's ears weekly to learn what is normal for your pet and to detect inflammation early. If you notice a large amount of hair, waxy debris, redness, foul odor, and/or pain, you should contact your veterinarian before attempting to clean the ears. Attempting to clean an inflamed ear may damage delicate structures in the deeper portions of the ear canal. To clean your pet's ear, lift the ear flap and instill the recommended ear cleaner into the vertical canal until it starts to spill over the top. Begin to gently massage the outer portion of the vertical canal for 15 to 20 seconds. The massaging action loosens up debris within the canal. After massaging, step back and allow your pet to shake its head. The shaking motion pulls the debris from the horizontal canal into the vertical canal where it can be removed with a soft cloth. Cotton balls should be used with caution so they do not lodge within the ear canal. Do not use cotton tip applicators or Q-tips to clean out your pet's ears, as you can cause trauma to the deeper portions of the ear if your pet moves unexpectedly. A good rule of thumb when cleaning your pet's ear is do not wipe where you cannot see. Repeat the ear flushing process on the other side. Some pets with larger amounts of waxy debris may require this process to be repeated. Your veterinarian will discuss the frequency of ear cleanings needed by your pet, as well as specific types of ear cleaners recommended. If a medication was prescribed for your pet's ears, it's best to wait 20 to 30 minutes after cleaning so that the ear cleaner does not dilute the medication you are instilling. To apply the ear drops into your pet's ears, lift the ear flap with your non-dominant hand. With your dominant hand, instill the prescribed number of drops into the vertical canal. You will also need to apply some of the medicated drops to the inner portion of the ear flap. Massage the vertical canal for 15 to 20 seconds to encourage the ear drops to enter the horizontal canal. When treating for an ear infection, be sure to medicate your pet for the entire time prescribed by your veterinarian. Although the infection may appear to be resolved from the outside, the infection deep within the canal needs a longer amount of time to resolve. Shortening treatment times may lead to unresolved infections. If your pet experiences any of the following, you need to stop all ear therapy and call your veterinarian. 1. Pain. 2. Loss of hearing. 3. Head tilt. 4. Rapid movement of the eyes. 5. Worsening of condition. Follow-up evaluation by your veterinarian may be recommended to ensure that the infection cleared completely. Degenerative joint disease. Degenerative joint disease, or osteoarthritis, is a progressive deterioration of the tissues that line the joints. Within normal joints, smooth cartilage covers the ends of bone to ease their movement against each other. Unstable joints and trauma cause abnormal wear of the cartilage, and over time, the cartilage degenerates and is lost. Without the presence of the cartilage, the bones do not glide across each other smoothly. Inflammation is created, resulting in pain. During the progression of degenerative joint disease, the capsule surrounding the joint thickens to attempt to stabilize the joint. Chronic inflammation within the joint creates unhealthy joint fluid and contributes to abnormal joint function. Both dogs and cats can be afflicted with degenerative joint disease. It can result from an injury, a developmental abnormality such as hip dysplasia, an immune-mediated disease, or an infection within the joint. The most common signs include slowing down on walks, pain on manipulation of the joint, inability to move the limb through its normal range, joint swelling, and crackling of the joint, which is called crepitus. The classic complaint associated with degenerative joint disease in dogs is that the pets are most stiff in the morning and are then able to work out their stiffness after about 15 minutes of activity. Signs of this disease in cats tend to be more subtle. Inability to jump up is high, resentment toward petting, and lack of litter box use. How is degenerative joint disease diagnosed? A thorough history and physical examination helps to localize the affected joints. Definitive diagnosis of this condition requires an X-ray of the affected joints. In more complicated forms of arthritis, a joint fluid sample must be obtained and examined microscopically. The damage caused by degenerative joint disease is irreversible. There is no cure for it. There are conditions in addition to medications that must be addressed to make your pet more comfortable. Let's review a few of these now. 1. Weight loss. Excess weight puts unnecessary pressure on the joints and exacerbates inflammation. Your veterinarian will work with you to ensure that your pet is at the proper weight to minimize further damage to the joints. 2. Proper diet. Joint problems can arise from oversupplementation with vitamins and minerals. Diet is particularly important in growing large breed dogs. Prescription diets are available to promote joint health. Ask your veterinarian if this is a good option for your pet. 3. Exercise. Regular exercise will help with weight loss, improve joint mobility, and increase muscle strength. Swimming and other rehabilitation programs are also excellent forms of exercise for arthritic dogs. In some severe cases, your veterinarian may recommend surgery to help stabilize the affected joint. Oral medications and supplements can be prescribed by your veterinarian to decrease joint inflammation and improve joint health. A combination of medications can be chosen to help find the best treatment regimen to improve the comfort of your pet. Your veterinarian will discuss benefits and side effects of the currently available choices. Degenerative joint disease is a progressive and potentially debilitating condition. Your veterinarian will help identify if your pet has the condition. With continued consultation, you can help ensure the best outcome for your pet. Dental health and your pet. Periodontal or dental disease is a common finding in dogs and cats. It is estimated that 65 to 85% of all dogs and cats over the age of 3 years have some type of periodontal disease. The dental problems your pet faces are different from many dental issues in people. In people, most dental disease is caused by tooth decay, whereas in pets, the problems are caused by periodontal disease. Similar to people, though, some dogs and cats are more susceptible to dental disease than others. Small breed dogs, greyhounds, and senior pets are more predisposed to having problems with their teeth. Periodontal disease in our animal friends begins with the formation of plaque on the teeth. Plaque is an accumulation of bacteria, saliva, and food debris near the gum line and between the teeth. If the plaque stays on the teeth, it will continue to build up and mineralize to form tartar. As tartar accumulates on the teeth, the gums become infected with oral bacteria, creating inflammation above and below the gum line. The combination of infection and gum inflammation cause the gums to pull away from the tooth roots. This gum recession allows the infection to spread into the support structures and roots of the teeth. There are several signs that your pet may need to be examined for dental disease. One of the first signs is persistent bad breath. Other indicators of oral disease include red, swollen, or bleeding gums, pain in the mouth manifested as a reluctance to chew, dropping food, teeth chattering, and unwillingness to play with objects using the mouth. As very few pets show any indication of dental disease until severe problems develop, an annual examination by your veterinarian can help detect oral disease sooner. Besides the oral discomfort caused by tooth and gum disease, there are other serious consequences to neglecting periodontal disease in your pet. The buildup of infection in the oral cavity can be circulated to the rest of the body when your pet chews on food. The most common organs affected by the traveling bacteria are the kidneys, liver, and heart. Removing plaque before it has hardened or mineralized on the teeth is the goal of a good preventive program. Once plaque has mineralized into tartar, it must be removed by your veterinarian. Treatment for periodontal disease involves a dental examination and thorough teeth cleaning by your veterinarian. While your pet is awake, only a limited exam will be possible. The teeth cleaning process, using a combination of ultrasonic equipment and dental tools, is accomplished under general anesthesia. Before awaking from anesthesia, your pet's teeth will be polished to remove any crevices in the teeth caused by the removal of tartar and calculus. Once your pet's teeth are clean, your pet will have a complete oral examination done, including a thorough visual observation of all teeth and gums, the tonsils, the throat, and the tongue. As in people, dental x-rays are used to detect dental pathology that occurs below the gum line. Since most dental pathology in dogs and cats is hidden below the gum line, x-rays are of utmost importance to detect hidden signs of dental disease. Medications may be prescribed before and after the dental procedure to treat any infections and provide pain relief. Maintaining oral health after the cleaning procedure is paramount for long-term oral health and to prevent recurrence of periodontal disease. To maintain a healthy oral cavity in your pet, begin with toothbrushing. Daily brushing is best, and 3 to 4 times a week should be the minimum. Be sure to use toothpaste that is designed for dogs and cats. Do not use toothpaste designed for people, as it can be toxic when swallowed. A pet at any age can learn that toothbrushing can be fun. To introduce the toothbrush, you can let your pet initially lick the flavored toothpaste off the toothbrush. After doing this daily for a couple of weeks, begin to slowly move the toothbrush into your pet's mouth. With time and patience, your pet will soon be allowing you to brush their teeth. In addition to brushing, oral health can be maintained by feeding a dry kibble diet. The mechanical chewing helps prevent some plaque accumulation. If your pet has moderate to severe dental disease, your veterinarian may prescribe dental chews or a diet specific for your pet's dental needs. Chew toys can also be helpful to remove tartar from the teeth. Some dogs and cats accumulate plaque and tartar more frequently than others, just like people, and may need a dental cleaning every 6 to 12 months. Your veterinarian will guide you in achieving an optimal dental treatment plan for your pet. Otitis externa, or an external ear infection, is a common problem for dogs and cats. Ear infections can be acutely painful for your pet. The discomfort from an ear infection is often evidenced by scratching of the ear, rubbing the ear or side of the face on the ground or furniture, or being head shy. More subtle signs of an ear infection include a foul odor from the ears, redness of the ear flap, and/or debris within the ear canal. Ear infections can be caused by bacterial or yeast organisms. The infections are caused by an underlying problem that sets up an environment to allow bacteria and/or yeast growth. The organisms that cause the infection are normal flora of the ear canal. However, inflammation causes their overgrowth. Predisposing factors for developing ear infections in dogs and cats include allergies, foreign bodies, trauma, chemical irritants, ear mite infections. Hypothyroidism can also be a cause of chronic ear infections. Pets may also develop ear infections from frequent exposure of the ear to water from swimming or bathing. Breeds with hair in the ear canals or heavy drooping ears often experience more frequent infections due to moisture accumulation and inadequate air ventilation within the ear canal. Ear infections may also be chronic in some pets. The most common causes of chronic ear problems include allergies and middle ear infections. In people, middle ear infections originate from the eustachian tubes in the oral cavity. In dogs and cats, however, middle ear infections originate from the external ear canal. External ear infections that are not completely resolved result in middle ear infections. Over time, the inflammation deep in the ear canal increases and the infection pushes through the eardrum into the middle ear. Aggressive therapy for middle ear infection is required to prevent hearing loss and permanent damage to the ear canal. The pain from ear infections can be debilitating for your pet and requires immediate veterinary attention. Your veterinarian will advise you about proper treatment and management of your pet's ear infection. Exercising your pet. Developing an exercise program for your cat and dog is important to their overall well-being. Regular exercise not only builds strength and endurance, it leads to fewer obesity-related illnesses and undesired behaviors. By following some general guidelines, you will help your pet stay fit and active their entire life. These good habits will provide them an excellent quality of life. Starting with our canine friends, puppies of any breed should be acclimated to a collar and leash early in life. Some dogs will do better with a harness instead of a neck collar. There are many types of collars and harnesses to choose from. Ask your veterinarian or trainer for the best choice for your dog. This early restraint training will ensure that your dog is safe and will be a joy to walk. Once a puppy can be safely handled on a leash, begin slow and steady walks 2 to 3 times a day. Remember, do not allow a young puppy to become fatigued, as it may become unwilling to participate on subsequent adventures. Gradually increase the walking distance until a target range is reached. This distance will vary for each dog, mainly based on the dog's age, health status, and breed. Your veterinarian can help you establish guidelines for your dog. Dogs confined to small spaces will need more outside exercise than those that have the run of a large yard. Most dogs enjoy retrieving balls, ropes, and frisbees, swimming and playing with other canine companions. When dogs are outside alone, leave a good supply of safe toys for them to play with and chase. For our feline friends, exercise can be a challenge. To encourage activity, provide multiple toys that will stimulate play and jumping activity. While you won't get as much exercise, it's always fun to watch your cat enjoy their playtime. Aiming for 3 to 4 times a day of intense activity for your cat is best. Remember to consult your veterinarian before starting any exercise program to ensure your pet doesn't have any health conditions that need to be addressed first. A key goal is for everyone to have fun during play and exercise while ensuring your pet's optimal health. Fleas. Fleas are common external parasites and are prevalent throughout the world, particularly in warm climates. Fleas are not only a nuisance, but they carry and transmit many diseases that threaten the health of our pets and people. Indications that your pet has fleas can range from subtle to obvious. Not all animals are itchy with flea bites, and the infestation may go unnoticed until the animal is severely compromised. Large numbers of fleas can ingest enough blood to cause anemia. Young, geriatric, and debilitated animals are most susceptible to the consequences of flea infestations. The obvious sign of a flea problem is seeing the actual flea. Fleas are commonly found along the back and tail. The abdomen is another place to see fleas easily, as there is not as much fur in the way. A more subtle indication that your pet has fleas is finding flea dirt, which is the same as flea feces. Flea dirt looks like pepper sprinkled within your pet's coat. It can be distinguished from regular dirt by sprinkling water over it. Flea dirt will turn red because it contains blood. Treating for fleas can be challenging. It is important to note that when treating for fleas, the adult flea is only 1% of the entire problem. The other 99% of the problem is in your pet's environment and invisible to the naked eye. Adult fleas deposit their eggs in the fur of their host animal. Each female flea can produce up to 3,000 eggs in its lifetime. The flea eggs drop off the host animal into the environment. 1 to 8 days later, the eggs hatch into larvae. The larvae are free-living and feed on organic material for a period of up to 3 weeks. After this period, the larvae form protective cocoons called pupa. The pupa stage is resistant to drying, freezing, and insecticides. Within 1 to 2 weeks of development, each pupa contains an adult flea that can remain protected inside the pupa for up to 300 days until conditions are optimal for hatching. Once hatched, the new adult fleas climb to the top of carpet or bedding inside the home or on top of vegetation in the yard, waiting for a host to pass by. Fleas begin feeding immediately upon attaching to a host. Once the flea has found a host, it typically will not leave unless forced off by insecticides or the animal's attempts to groom them away. While a flea can take nearly a year to complete its life cycle, most household conditions allow the life cycle to be completed in as short as 3 to 6 weeks. Fleas are susceptible to cold weather and will die if exposed to temperatures below 36 degrees for several days. However, most fleas survive the winter by staying on host animals and in homes where they're warm and protected. Controlling a flea outbreak requires treating your pet directly as well as their environment. To eliminate the existing infestation on your pet as quickly as possible, a flea bath or dip by your veterinarian or grooming facility can provide immediate results. Oral medication is also available from your veterinarian to kill the flea population in as little as 30 minutes to 5 hours. It is important to note that bathing, dipping, and the fast-acting oral medication do not have any long-lasting effects. They merely kill the adult fleas on your pet when they are administered. For long-term control of fleas on your pet, monthly application of a topical product will kill adult fleas in 12 to 48 hours and provide longer-lasting protection. To tackle the remainder of the flea family, the environment must be treated. All pet bedding should be washed in hot water or discarded. All carpets should be thoroughly cleaned and vacuumed. Because flea larvae like to hide in dark places, be sure to vacuum under furniture. Always remember to bag, seal, and discard all vacuumed material immediately. For yard control, seek help from a professional exterminator. For a variety of reasons, some flea problems are resistant to treatment and may require multiple approaches to achieve desired results. Always be vigilant for flea problems to avoid infestations. Your veterinarian will help you plan a course of action to keep your pet and your family safe from fleas. Geriatric pets and senior wellness. Geriatric refers to an aging or senior pet. In determining a human reference for your pet's age, the old formula of 1 human year equals 7 years for a dog or cat is actually inaccurate. Dogs have a complex aging formula based on size and breed. Large or giant breed dogs tend to have shorter lifespans, 7 to 11 years, when compared to toy breeds, 14 to 18 years. Thus, geriatric programs begin at different ages with different breeds. For cats of any breed or size, you should consider age 7 years and above as a senior cat. cats that are well cared for, live mainly in the home, and are in good physical condition can live for 18 to 20 years or more. Most cats can easily have a life expectancy of 12 to 15 years or more. Geriatric dogs and cats require additional care. To ensure optimal health and comfort, comprehensive physical exams should be done twice each year for all dogs and cats in their golden years. To detect early signs of illness, the wellness evaluation should also include blood work and a urinalysis. These laboratory tests are the only way to evaluate organ function. Additional testing may be recommended by your veterinarian based on examination findings. Although your geriatric pet may appear to be in good health, the comprehensive examination and lab work will help your veterinarian provide early intervention for hidden conditions. Our aging pets tend to have common maladies. Additional steps to make life more comfortable for your senior dog or cat are easily accomplished. Let's go over some of these now. Arthritis. Accommodate aging joints by keeping your pet's weight healthy. Soft, padded bedding helps to ease joint pain. Your veterinarian will talk with you about pain control and supplements for maintenance of joint health. Consistent, low-impact activity will help keep joints mobile and muscles strong. Fresh water. Keeping plenty of fresh water available at all times is important for all pets, but especially for senior cats and dogs. If you notice changes in your pet's water consumption or urinary habits, you should consult with your veterinarian. Vision and hearing loss. Eyesight and hearing can be lost as your pet ages. With vision loss, most pets will still function well in your home as long as furniture, litter boxes, food, and water are not moved too drastically. Aging pets should not be placed in situations outside of their normal environments that might prove dangerous, such as off-leash walks. Diet. All senior dogs and cats should be placed on diets specially formulated for their age, activity level, and any underlying medical conditions they may have. Your healthcare professional will direct you in choosing a diet that is best for your pet. The key to a long and healthy life for your aging pet is anticipating and preventing medical problems whenever possible. If you have any concerns about your aging pet, be sure to discuss them with your veterinarian. Heartworm disease in dogs. Heartworm disease in dogs is the result of an infection by a worm, Dirofilaria immutus. Heartworm infection is acquired by dogs after an infected mosquito takes a blood meal from the dog. To understand how to prevent heartworm disease in your dog, let's take a look at the life cycle of the heartworm. The life cycle of the heartworm begins when a mosquito feeds on a heartworm-infected animal and ingests an immature, microscopic stage of the heartworm called microfilaria. Once inside the mosquito, the microfilaria develop into infective larvae within 1 to 4 weeks, depending on external temperatures. When the mosquito takes its next blood meal from a susceptible host, such as your dog, the infected larvae are deposited into the skin surrounding the bite. The infected larvae grow into the dog's skin for up to 2 weeks before migrating through the animal's body in the bloodstream. After about 2 months, the larvae arrive in the pulmonary artery, where they will complete their maturation to adult worms in the following 3 months. Once in the pulmonary artery, the young adult worms fully mature. Adult female heartworms can grow to 12 inches in length. Mature worms will mate and produce offspring known as microfilaria that are released into the circulation. The microfilaria circulate throughout the body, waiting to be taken up by the biting mosquito. The entire process, from the initial mosquito bite to the adult female worms producing microfilaria, requires between 6 and 7 months, depending on environmental temperatures. Adult heartworms can live 3 to 5 years in your dog's body. The microfilaria that they produce can survive 1 to 2 years in the bloodstream, awaiting a mosquito to ingest them to restart the heartworm life cycle again. All dogs are at risk of contracting a heartworm infection. Regions with constant temperatures above 65 degrees experience heartworm transmission year-round. Northern climates that experience cold winters may have a break in the heartworm cycle during the colder months. Infected dogs show many different signs of heartworm disease. While coughing, exercise intolerance, or tiring easily are seen in most cases, it is important to note that some dogs only show a decline in general condition. Heartworms initially cause damage to the blood vessels around the heart. Over time, the inflammation spreads to include the lungs. The lung inflammation produces the classic cough and breathing difficulties that are associated with heartworm disease. Left untreated, the worm burden multiplies and the worms begin to move into the chambers of the heart, impairing function. If the infection still goes untreated, the ever-growing population of worms begins to migrate toward the liver, with acute death typically happening shortly thereafter. Heartworm infection creates a tremendous stimulation to the dog's immune system, resulting in a profound inflammatory response throughout the body. In the majority of cases, heartworm disease that is untreated will result in a dog's early death. Diagnosis of heartworm infection involves a simple blood test. The blood test commonly used, called an antigen test, detects small pieces of the female worm's body. If the antigen test is positive, then further testing needs to be done to determine the extent of the heartworm infection. Additional tests used to stage the disease include a blood test to check for the presence of microfilaria, chest x-rays, and an ultrasound of the heart. Based on the results of the physical examination and these diagnostic tests, your veterinarian will determine a plan for treating the heartworm infection. Safe treatment of a heartworm infection is done in phases. The goal of the first treatment phase is to kill the adult heartworms. The only licensed, effective treatment for heartworm infection is an injectable drug administered only by your veterinarian. Treatment for heartworm infection is not without risk. The injection can cause serious adverse reactions, which your veterinarian will discuss with you prior to initiating therapy. The dog's immune system destroys and eliminates the dead adult worms. This process of destruction creates a tremendous amount of inflammation in your dog's body. Your veterinarian will advise you to confine and strictly control the movement of your dog for several weeks after treatment. As this is a dangerous time for your dog, it will be critical to completely follow all instructions given by your veterinarian. As the adult worms are being treated, your dog needs to be started on medication to kill the circulating microfilaria as well. Eliminating the microfilaria is important so that your dog does not act as a reservoir to continue the spread of the heartworm. To avoid this risky treatment, protection is the best medicine. The main goal is to avoid this potentially fatal disease altogether. During your pet's wellness exams, your veterinarian will discuss a heartworm preventive medication that will be best for your dog. Available in tablet, chewable, or topical forms that are given every 30 days, today's heartworm preventives are affordable, safe, and effective. For convenience, some of the heartworm preventive medications are combined with drugs that prevent and control infections by intestinal parasites, fleas, and ticks. Ask your veterinarian about which preventive is best for your pet. Prevention of heartworm disease, not treatment, is always the goal for protecting our canine friends. Heartworm disease in cats. Heartworm disease is caused by an infection with a worm, Dirofilaria emutus. Heartworm infection has long been recognized in dogs and is emerging as an important disease in cats as well. Heartworm infection is carried and transmitted by mosquitoes. All outside cats are at increased risk of contracting a heartworm infection. Cats, including house cats, are at a higher risk of heartworm infection if they live in warmer areas with higher mosquito populations. It is important to realize that indoor cats are just as susceptible to heartworms, and nearly 30% of cats affected with this disease were entirely indoors. There are some species of mosquito that actually prefer an indoor environment. The standard life cycle of the heartworm does not completely apply to the cat as it does the dog. Because cats are not natural hosts for the heartworm, they experience the infection differently than dogs. The immune system of cats mounts a much stronger response to heartworm infection than dogs. Thus, the heartworm often is not able to mature and complete its life cycle in the cat as it does in the dog. Due to the strong immune response in cats, immature forms of the heartworm are killed before developing into sexually mature adults. For the immature worms that do survive the cat's immune system and develop into adults, the completion of the life cycle is still truncated. Due to low worm numbers, usually 1 to 5 adult worms, the heartworm infections in cats are commonly with same-sex worms only. If mating does occur, the microfilaria or immature offspring they produce are immediately destroyed by a cat's immune system. Thus, cats typically have an absence of microfilaria in their blood. While the number of worms present in cats is low, the inflammation caused by them can be profound. Unfortunately, cats infected with heartworms often show vague signs of illness. Symptoms such as vomiting, coughing, lethargy, and weight loss are common with many different medical problems, including heartworm infection. Cats that have heartworm infection can be initially thought of as having asthma, as the signs are similar. Sadly, some cats show no signs of heartworm disease, and the infection is diagnosed after an acute death. Diagnosis of heartworm disease in cats can prove to be a challenge. The low worm numbers can make detection difficult. Identification of a feline heartworm infection requires specialized blood tests, X-rays of the heart and lungs, and an ultrasound of the heart. Currently, there are no approved treatments for cats with heartworm disease. Therefore, it is critical that every cat in an environment where heartworm infections exist be placed on an effective feline heartworm preventive medication. Prevention is the best option for protecting cats against this potentially fatal disease. Ask your veterinarian to recommend the best medication for your feline companion. Intestinal parasites. The most common parasites found in the intestinal tracts of dogs and cats are hookworms and roundworms. An understanding of these parasites is crucial, as parasites can be transmitted from your pet to you and your family. Dogs and cats of any age can become infected with hookworms and roundworms, but young kittens or puppies are the most susceptible. In fact, the majority of puppies and kittens are born with roundworms that they acquired from their mothers before birth or shortly thereafter from their mother's milk. Puppies as young as 2 weeks of age can carry a dangerous number of hookworms and/or roundworms in their intestines. The life cycle of a roundworm begins when your pet comes into contact with feces contaminated with roundworm eggs in the environment. When your pet licks their paws or fur, they swallow the infective eggs. Roundworm infections are also acquired if your pet eats an animal such as a rodent whose tissues contain the encysted roundworm larva. Once the eggs are swallowed, they hatch into the larval stage in the gastrointestinal tract. The larvae then penetrate the lining of the intestines to fully mature, then re-enter the intestine to feed and reproduce. Some of the larvae will migrate away from the intestinal tract to the liver, lungs, kidneys, and other tissues and become encapsulated by the body. These larvae often remain dormant in these tissues. The adult female worms, which mature in the small intestine, are capable of laying thousands of eggs. These eggs pass into the environment through your pet's feces to begin the life cycle again. Roundworms commonly cause vomiting, loss of appetite, distended abdomens, weight loss, and dull, rough hair coats. If humans, especially children, come in contact with feces contaminated with roundworm eggs, the migrating larva can cause serious disease. This condition, known as visceral larval migrans or wandering worms, can cause fever, liver and lung problems, and loss of vision if the larvae migrate to the eye. The life cycle of hookworms begins when your pet comes into contact with infective hookworm larvae in the environment. Hookworms can enter the body through ingestion, as with roundworms, or they can enter the body through the skin. Once inside the body, the larvae migrate through the tissues to arrive in the small intestine to mature into adults. Attaching themselves to the intestinal lining, adult hookworms suck blood from their host's body. The adult female hookworm may lay up to 20,000 eggs a day in the host animal's intestine. These eggs then pass into the environment in your pet's feces. When excreted from the body, the eggs quickly hatch and become infective larvae to begin the cycle again. Hookworms commonly cause vomiting, loss of appetite, distended abdomens, weight loss, and they can also cause anemia due to blood loss with heavy infections. Hookworm infection in people can cause cutaneous larval migrans resulting in severe skin reactions. Both hookworms and roundworms are diagnosed by microscopic examination of the feces to identify the parasite eggs. It is not common to see these parasites in your pet's stool without a microscope. Whipworms, while rare in the cat, are another common intestinal parasite of the dog. Dogs acquire whipworms after ingesting an infective egg in the environment. Once mature, these parasites attach to the wall of the large intestine to feed. In mild infections, no clinical signs are seen. However, in large numbers, whipworms create inflammation in the large intestine, resulting in diarrhea and weight loss. Whipworm infections can be difficult to control because the eggs are difficult to eliminate and persist in the environment for extended periods of time. Treatment usually requires multiple treatments to resolve the infection. Dogs and cats can also become infected with tapeworms. One type, Dipylidium, requires the ingestion of a flea containing an infective stage of a tapeworm. The swallowed flea is digested and releases the tapeworm larva that migrates to the intestine of the dog or cat. As the larva becomes an adult, it begins forming segments that are released over time and carry infective eggs into the feces. When released, these segments are similar in appearance to a grain of rice. They can often be seen moving in the feces or on the hair around the hindquarters of the dog or cat. Other tapeworms can infect your pets. These tapeworms, commonly called tinea, are acquired through hunting behavior. When your pet eats an animal infected with an infective stage of the tapeworm, the infection is passed on. Dogs and cats that actively hunt may transmit a tapeworm to people that can cause serious illness. If your pet is a hunter, be sure to notify your veterinarian so that a preventive program can be discussed. All tapeworms are easily treated by your veterinarian. Annual exams of your pet's feces by your veterinarian will ensure your pet remains free of intestinal parasites. Based on your pet's lifestyle, your veterinary professional will discuss a parasite control program with you, an important safety precaution for both your pet and your family's health. Neutering your pet. Orchidectomy, or castration, is commonly referred to as a neuter. This procedure is one of the most frequently performed surgeries in veterinary medicine. A simple neuter involves the removal of both testicles to sterilize your pet. The surgery is typically performed when your pet is between 4 and 9 months of age. There are many reasons to perform a neuter surgery. The primary reason to perform this procedure is to help control the pet population and reduce the millions of unwanted dogs and cats that are euthanized each year. Neutering also helps control undesirable behaviors such as roaming, aggression, and territorial marking with urine. Medical reasons for the procedure include preventing and treating prostatic and testicular diseases and hormone-related issues such as hernias and certain tumors. While neutering is a routinely performed surgery, it is still a major procedure and requires careful administration of anesthesia, pre-surgical pain medications, monitoring of vital signs, and excellent surgical skills. Your veterinarian will perform the surgery only after a careful examination of your pet and analysis of pre-surgery blood work to be sure your pet is in good health. Following surgery, pain medication will be sent home for your pet's comfort. Post-surgical care requires 2 weeks of reduced activity before your pet can return to all normal routines. Strict adherence to your veterinarian's recommendations will ensure that your pet experiences a safe recovery from the surgery. Except in rare circumstances, there are no medical reasons to not have your dog or cat neutered. Concerns about behavior changes following surgery, including personality changes, reduced displays of affection, reduced activity levels, and loss of the instinct to guard your home are myths. The benefits of neutering your pet far outweigh any negative effects. Your veterinarian will provide you with additional information to address any of your concerns and questions about your pet's procedure. Nutrition for cats. Both cats and dogs are carnivores. The cat is unique, however, in that it is a strict carnivore. The nutritional needs of a cat are much different than a dog. Unlike dogs, cats are unable to manufacture some nutrients in their own bodies, and they must take them in through their diet. Feline diets that are nutritionally complete and balanced provide the proper amount of fatty acids, protein, and vitamins that cats require. Our feline friends are obligated to ingest pre-formed nutrients that are found only in a predominantly meat-based diet. Cats have evolved as efficient small animal hunters to supply their bodies with these specific metabolic needs. Proper food management at all ages of your cat's life is the key to maintaining good health and helping prevent illness. Nutritional needs for your cat are thoroughly researched and well documented. These nutrient requirements include a diet of high-quality, digestible proteins and fats that can be adequately absorbed and utilized. A high-quality dry food will meet all of your pet's nutritional needs. If you prefer, a combination of recommended dry and canned formulations is acceptable. Inexpensive foods, while appealing to the pocketbook, are often poorly formulated and contain low-quality, poorly utilized nutrients. Pet food labels can be confusing to read and understand. A general rule to follow in selecting your cat's food is to choose a diet that meets the requirements of the Association of American Feed Control Officials, AFCO. This organization sets the standards for the pet food industry. Your veterinarian will guide you in the selection of a diet that will provide the best nutrition for your cat at each life stage to ensure optimum health. Nutrition for dogs. While dogs belong to the order Carnivora, they are best described as omnivores. That is, dogs eat and flourish on a diet of plant and animal proteins. Proper food management at all life stages is the key to maintain good health and prevent illness. Nutritional needs for each stage of your dog's life are thoroughly researched and well documented. These nutrient requirements call for a nutritionally complete and balanced diet of high-quality, digestible proteins, fats, vitamins, and minerals. When selecting your pet's food, a general rule to follow is to choose a diet that meets the requirements of the Association of American Feed Control Officials. The organization sets the standards for the pet food industry, and their acronym, AFCO, will appear on the food label. Premium brand foods, while more expensive, provide higher quality nutrients for optimal nutritional health. Less expensive generic brands are often filled with poor quality proteins and fats and are less likely to be nutritionally complete and balanced. A high quality dry food will meet all of your pet's nutritional needs. Your dog will generally eat less of the higher quality diet because it is more nutritionally complete. Another benefit of higher quality diets is that they lead to less fecal waste. If you prefer, a combination of recommended dry and canned formulations is acceptable. Pet food labels can be confusing to read and understand. Your veterinary professional will guide you in choosing a diet that is best for your dog at each age life stage to ensure optimal health. Obesity. Obesity is the excess accumulation of fat in the body. Just as in people, obesity in pets causes health issues and decreased life expectancy. Unfortunately, obesity in the pet population is on the rise and now affects at least 1/3 of the dog and cat population. Carrying around excess body weight will predispose your pet to many health conditions. Pets that are overweight experience arthritis, heart and liver disease, breathing difficulties, infections due to hygiene problems, as well as stress on other organs of the body. Obesity can also lead to diabetes. There are many factors that can contribute to weight gain in your pet. The most common cause is overconsumption of food with lack of adequate exercise. Metabolic conditions such as low thyroid hormone level may also put the pounds on your pet. Changes in your pet's health may change your pet's energy requirements. As part of your pet's annual wellness examination, your veterinary healthcare professional will help you understand your pet's current energy needs. Your veterinarian will evaluate your pet's body condition score to determine if your pet is overweight. To determine a condition score, your veterinarian will put their hands on your pet's ribs, spine, and hips to feel how much cushion is present. The bones of the ribs, spine, and hips should be readily palpable. You should not have to push down to feel them. An ideal body condition score is a 5 on a 9-point scale and a 3 on a 5-point scale. Weight reduction for your pet can be challenging for everyone involved, including you. Do not be discouraged if your pet does not immediately drop excess weight. Weight reduction to acceptable levels may take up to 1 year for some pets. Here are some tips to help you get started. Begin by measuring the amount of food you feed with measuring cups, not butter tubs. Keep a log of everything your pet eats. Don't forget that little bit of peanut butter that you give them when you come home. Feed your pet only at specified meal times. Trust your veterinarian to provide you with specific guidelines to safely reduce your pet's weight. These guidelines may include diet control, exercise programs, prescription weight loss diets, and possible medical intervention through newly available drug treatments. Ongoing communication with your veterinarian is vital to ensure your pet is progressing toward a healthy goal. Remember, healthy weight leads to an increased life expectancy and improved quality of life for your pet. We promise it will be well worth your efforts. Pilling your pet. Administering medication to your pet can be a challenging endeavor to take on. However, with some tips, you can be successful. Before giving any medication, always check the name of the medication and instructions on the label. Remove the medication to be given and set it near you. If the prescribed medication can be given with food, wrap the pill in a small amount of tasty food to see if your pet will readily take the medicine. This technique works best if done before feeding a meal. Do not split any tablets to ease administration unless your veterinarian has instructed you to do so. Some pets are wise to hiding the pill in food and will need to be approached differently. Options for pets that are more difficult to medicate include pilling your pet, formulating the medication into a chewable form at a reputable compounding pharmacy. Try a liquid formulation. Pilling your pet for the first time may require 2 people, one to hold and comfort your pet and one to give the medication. Find a place in your home that is quiet and calm to attempt medicating your pet. To keep your pet close to you, stand behind their body. You can hold them between your legs. Cats and small dogs can be wrapped in a towel to hold them close while giving the medication. For larger dogs, sitting them in a corner can be helpful to hold them still. Pilling your pet requires patience. Initially, several attempts may be necessary to complete the task. With practice, you and your pet will become more comfortable with the technique. To pill your pet, pick up the medication in your dominant hand. Use your non-dominant hand to lift the head up. In cats, lifting the head is most easily done by grasping the upper jaw with the thumb and middle finger. For dogs, elevate the head by grasping the muzzle from the top. Lift the head until the nose points to the sky. As you do this, you will notice that the mouth begins to open. To open the mouth, use your dominant hand to press down the lower jaw with your middle finger. When the mouth is open widely, drop the pill to the back of the throat, where the tongue meets the roof of the mouth. Do not put your fingers in your pet's mouth. Do not risk getting bit. Close the mouth. To stimulate swallowing in cats, lightly tap your cat's nose after closing their mouth. For dogs, lightly blow on your dog's nose after closing their mouth to stimulate swallowing. Praise your pet after they have taken their medication. Give yourself a pat on the back too for a job well done. If you cannot safely and consistently administer your pet's medication, contact your family veterinarian for other options available. Safety for you and your pet are most important. Post-op instructions. Your pet has undergone a procedure that required general anesthesia. The staff at your veterinary hospital has ensured that your pet has recovered safely from anesthesia. Because some of the anesthetic effects take longer to wear off, you will need to monitor your pet closely at home until complete recovery. When your pet arrives at home, you may offer a small amount of water. Do not allow your pet to drink too much as it may cause stomach upset. Wait a few hours before offering your pet a small meal. If there is no stomach upset after a couple of hours, then you may offer a small amount more. Regular feeding should resume the following day. Depending on the type of surgery your pet had, specific exercise restrictions may be recommended. To decrease complications after surgery, your pet needs to be rested for the next 2 weeks. By resting, this means short, leashed walks only, no running or jumping. Excess activity may cause incisions to break down and result in healing difficulties. Your pet's incision needs to be monitored 2 to 3 times daily. Sutures may be placed in the skin that you can see, or the sutures may be under the skin where you cannot see them. Monitor the incision for redness, warmth, discharge, lost sutures, openings in the wound, and swellings. A small degree of redness and swelling is normal the first day or 2 following surgery. Your veterinarian staff will show you your pet's incision before you leave the hospital. Keep your pet's incision clean to avoid infection and irritation. To clean the incision, use a wet cloth to clean the area. Do not use soap or hydrogen peroxide as they may interfere with the healing process. Do not allow your pet to lick the incision. Licking causes sutures to loosen and may create inflammation and infection. If your pet is licking the incision, call your veterinarian's office for your pet to be fit with a collar to prevent licking. If your pet has sutures in the skin, you will be informed of a time to return for removal. Do not attempt to remove sutures at home. Some surgeries require placement of a bandage or dressing over the wound. Your veterinarian will inform you of how often the dressings need to be changed. The dressing needs to remain clean and dry to avoid infection. If the dressing becomes soiled or comes off, contact your veterinarian's office for a replacement as soon as possible. During the healing process, do not bathe your pet unless you have been given specific directions to do so by your veterinarian. Once the sutures in the skin are removed, you may bathe your pet if desired. Any medications prescribed by your veterinarian should be administered as directed. Complete the entire course of the recommended treatment to avoid complications. If during the recovery period your pet experiences any of the following, you need to call your veterinarian. 1. Lack of an appetite after 24 hours. 2. Any vomiting or diarrhea. 3. Worsening of condition. 4. Pain not controlled. 5. Incision opens, becomes inflamed, or develops a discharge. Be sure to ask your trusted veterinary staff if you have any questions or concerns about your pet's condition. Your pet's comfort is our priority. Spaying your pet. Ovariohysterectomy, or spay, is one of the most commonly performed surgeries in veterinary medicine. This spay surgery involves the removal of the uterus and ovaries from a female dog or cat, thus preventing future pregnancies. Spaying should be performed before the first heat cycle, usually when the pet is between 4 and 6 months of age. There are many reasons to perform a spay surgery. The primary reason to perform this procedure is to help control the pet population and reduce the millions of unwanted dogs and cats that are euthanized each year. Other benefits to spaying your pet include reducing the incidence of mammary tumors and preventing infections and tumors of the reproductive tract. Dogs and cats spayed before their first heat cycle will have a less than 1% chance of developing certain cancers. The risks of ovarian and uterine cancers, as well as uterine infections, are completely eliminated with this surgery. Spaying also stops false pregnancies in dogs and undesirable behaviors associated with a cat being in heat. While spaying is a commonly performed surgery, it is still a major abdominal surgery that requires careful administration of anesthesia, pre-surgical pain medications, monitoring of vital signs, and excellent surgical skills. Your veterinarian will perform the surgery only after a careful examination of your pet and analysis of pre-surgery blood work to be sure your pet is in good health. Following surgery, pain medication will be sent home for your pet's comfort. Post-surgical care requires 2 weeks of reduced activity before your pet can return to all normal routines. Strict adherence to your veterinarian's recommendations will ensure that your pet experiences a safe recovery from the surgery. Except in rare circumstances, there are no reasons to avoid having your dog or cat spayed. The concerns about behavior changes following surgery, including personality changes, reduced displays of affection, and reduced activity levels, are all myths. The benefits of spaying your pet far outweigh any negative effects. Your veterinarian will provide you with additional information to address any of your concerns and questions. Vaccinations. Before your veterinarian discusses specific vaccines for your family pet, an overview of vaccinations will be given to help you understand why they are used and how they work. The primary purpose of a vaccine is to stimulate the immune system to produce protective antibodies against a specific infection. The antibodies formed will offer protection in case of real exposure to the infection. The goal of a vaccination program is to safely deliver a vaccine that produces a strong and lasting immune response. All vaccines contain antigens. Antigens are substances that stimulate the immune system. The antigens found in most vaccines are viruses and bacteria. For purposes of vaccination, the viruses and bacteria are modified in different ways to provide protection without causing disease. There are 3 general types of vaccinations used in veterinary medicine: killed, modified live, and recombinant vaccines. Killed vaccines contain antigens that have been inactivated to reduce the antigen's disease-causing ability. This inactivation allows the vaccine to be placed safely in your pet's body to produce a protective immune response. Modified live vaccines contain live viruses that have been genetically altered to stimulate the immune system but not cause disease. The benefit of a modified live vaccine is that it more closely mimics an actual infection and tends to provide stronger immune protection. The third category of vaccines is recombinant vaccines. Recombinant vaccines contain only the immune-stimulating pieces of viruses or bacteria. These new vaccines provide excellent protection against infection and improved safety over the other two vaccine types. The type of vaccines that will be given to your pet will depend on their age, health status, lifestyle, and geographic location. Vaccines can be given under the skin, in the muscle tissue, or as drops in the nose. Vaccinations should always be administered by an animal healthcare professional, as problems can occur if the vaccine is handled or delivered improperly. Adverse vaccine reactions do occur and cannot be predicted. Remember that along with the vaccination your veterinarian is giving, you are also receiving their invaluable professional advice and care. Puppies and kittens require a series of immunizations because of the potential presence of maternal antibodies in their bodies. These antibodies, passed through the mother's first milk, provide puppies and kittens a level of instant, short-term protection from common infections. Maternal antibodies can persist for 14 or more weeks in the young animal system and interfere with immunization process. There is a window of time when the young animal's immune system is maturing and the maternal antibodies are waning. This time period is when young animals are most susceptible to infection. Giving booster vaccinations every 3 to 4 weeks during this window of time is key to stimulating the maturing immune system to allow the best protection while the maternal antibodies diminish. It is important to realize that vaccination of your pet does not provide immediate protection. The immune system typically requires up to 14 days to mount a maximal response and to produce adequate levels of protection. Because of this, dogs and cats, especially puppies and kittens, should not be placed in exposure situations until they have completed their vaccination series. While uncommon, vaccine reactions do occur. Mild reactions include irritations at the injection site, such as swelling, pain, or formation of a knot. Some pets, especially puppies and kittens, may experience a reduced appetite and activity level for 12 to 24 hours following vaccinations. If your pet experiences any of these signs, treatment may not be necessary, but you should notify your veterinarian. Moderate reactions that require veterinary care include facial swelling, noisy breathing, hives, which are itchy bumps on the skin, and persistent mild reactions lasting more than 24 hours. Signs of a more severe reaction include vomiting, diarrhea, difficult breathing, profound lethargy, or collapse. If your pet shows any of these signs, it is an emergency and immediate treatment is required. Fortunately, most of these reactions happen while you are still at the veterinary clinic and help is close at hand. Vaccines are considered safe for healthy pets. However, in some cases, individual pets with underlying conditions may experience problems when a vaccine is administered. Before vaccinating your pet, your veterinarian will discuss your pet's lifestyle and medical history with you. Pets with a history of an adverse reaction to a vaccine or who are immunosuppressed should be vaccinated with caution, if at all. Your veterinarian will discuss any alternatives to immunization with you to keep your pet healthy and protected. Keeping your pet properly vaccinated is very important. Your veterinarian will recommend appropriate vaccine and booster schedules and will send you annual reminders to ensure your dog or cat remains protected. Wellness, the importance of routine veterinary care. As a dog or cat owner, your pet relies completely on you for its care and well-being. Establishing a comprehensive wellness program for your pet is important for long-term health and quality of life. Routine wellness exams not only identify potential problems before they progress, but they allow you and your veterinarian time to discuss the needs of your pet during different stages of their life. In the early years of your dog or cat's life, they should have a wellness examination every year. During the wellness exam, your veterinarian will check your pet's general appearance, body condition score, joints, skin, heart and lungs, internal organs, eyes, ears, lymph glands, teeth, and gum color. In addition to the comprehensive physical examination, your veterinarian may recommend some additional diagnostic tests. A fecal exam will help detect and control any intestinal parasites that can be dangerous to your pet. Depending on your geographic location, an annual heartworm test may be recommended as well. Since your pet cannot talk to you when they are feeling ill, screening laboratory tests can help bridge this communication gap. Additional screening blood work can be used to detect any early indications of organ problems or disease conditions. A urinalysis will complement the blood work to give your veterinarian a better picture of your pet's overall health. Since prevention truly is the best medicine, your veterinarian will recommend monthly heartworm, flea, tick, and intestinal parasite control products. Your pet's home dental care and nutritional needs will be reviewed with you to ensure optimal health. Be sure to talk with your trusted veterinarian about any concerns that you have about your pet. Your veterinarian has been extensively trained in prevention and early detection of disease, so use him or her as a resource for any questions or concerns about your pet's health.
In this program, we will explore what to feed your pet to avoid some of the problems associated with obesity. And of course, we'll also look at what not to feed. So, let's get started with some facts on pet obesity. Did you know that 35% of all dogs and cats are overweight? Did you know that obesity is the most common form of malnutrition in the United States? Did you know that obesity is the second most common disease in adult pets after periodontal disease? The fact is, obesity is directly or indirectly responsible for increased risks of heart disease, diabetes, joint problems, and breathing problems. So you see, obesity really is a serious disease in millions of dogs and cats. So how do you know if your pet is overweight or obese? We'll define an overweight dog or cat as a pet whose weight exceeds 10% of their ideal body weight, and obese as being 20% above their ideal body weight. Your veterinarian has a body scoring chart like the one shown here to help you recognize if your pet's weight might be excessive. A simple way for you to determine at home whether or not your pet is overweight or obese is to follow the rule that you should be able to feel the ribs but not see them. If it is difficult for you to easily feel your pet's ribs, it may be time to talk to your veterinarian about a weight management program for your pet. Such a weight management program is not difficult and will make your pet feel better and live a healthier life. There are two important keys to a successful weight management program for your pet, should they need it. First is exercise. A 20-minute walk or active playtime once or twice a day does wonders for burning those nasty calories. And second is choosing and maintaining the right food. Your veterinarian will have some great recommendations on helping to choose the very best food for your pet. But it's not enough to just feed the right food. It's also important to feed the correct amount. Every Hill's food comes with information that tells you the proper amount to feed based on your pet's size. The right food fed in the right amount means your dog or cat is getting just the perfect amount of nutrients they need to maintain an ideal weight. The reality is, Choosing the right food to feed your pet is the single most important thing to a successful weight management program. And of course, you can count on Hills to have the perfect weight management food for your dog or cat. Because each pet is unique and each varies in its struggle with weight issues, Hills has different foods for different pets. For example, canine and feline prescription diet RD pet foods are designed to aid obese dogs and cats in reducing their body weight. This amazing food utilizes fiber to increase the bulk. This results in your pet feeling satisfied, yet still losing weight. It also has the correct amount of L-carnitine. This amazing nutrient is shown to help burn excess fat. The results are amazing. Hill's Prescription Diet RD is the perfect food for those obese dogs and cats that need an aggressive weight-reducing program. Once your dog or cat is back to their ideal weight, your veterinarian will most likely recommend a Hill's food that aids in maintaining your pet's weight right where it should be. Foods such as Hill's Prescription Diet WD or Hill's Science Diet Light are nutritionally formulated with the perfect balance of nutrients, fiber, and L-carnitine to keep your pet looking and feeling great. Science Diet Light can also be used for moderate weight loss. Cats that are prone to weight gains do great on Hill's Prescription Diet MD. This innovative food for cats is low in carbs and high in protein, a proven formula for losing and keeping off the weight. If your dog or cat is just a little overweight or prone to becoming obese, one of these foods could be the perfect choice for them. Helping to prevent your dog or cat from becoming overweight or obese is one of the most loving things you can do for your pet. Of course, the area many pet owners struggle with is the temptation to offer their pets table scraps and lots of pet treats. Table scraps should always be avoided, as this not only promotes obesity in pets, but also leads to digestive and other disease problems. So if your pet is overweight or obese, ask your veterinarian about starting a weight management program. If your dog or cat has never experienced the great taste of these awesome Hill's foods, then make the switch today. If you're not sure which Hill's food is best for your dog or cat, ask your veterinarian. They have years of experience with Hill's products and will steer you in the right direction. And don't forget to make the switch from one food to another gradually. Quick changes in food often lead to digestive upsets, so make the transition over a week or so. Keeping your dog or cat healthy and at their proper weight is the best way to ensure they'll be around for years to come. Hills makes it easy and affordable to feed the very best to your dog or cat. In fact, Hills is so confident in your satisfaction that they offer a money-back guarantee if you're not 100% satisfied with the quality, consistency, or taste of any prescription diet product. Your veterinarian and Hill's Pet Nutrition are committed to the health and nutrition of your pet. Choosing the right food is the key to achieving and maintaining your pet's ideal weight. Your pet will thank you.
Another real-life weight loss success story from Hills. Sandy Kinsey and her family rescue dogs from situations that may threaten their lives. That's how she met Milo, a miniature pinscher that desperately needed to lose weight.
We picked up Milo at the shelter. They felt that Milo was not adoptable. He just laid around. Besides being unhealthy, he would not play with toys, he wouldn't run. He was just not a happy dog. We knew that we were his last chance.
So Sandy brought Milo to her veterinarian, Dr. Dale McKee. After giving Milo a full examination, Dr. McKee recommended feeding him Hill's Prescription Diet RD pet food to help him lose weight and receive the critical nutrition he needed.
I've used the Hills products for years. I was very confident of the product being safe and effective.
He also suggested very gradually increasing Milo's exercise routine.
We immediately put him on the Hills Prescription Diet RD, and started with very slow exercise, building up on a day-to-day basis.
Over 9 months, Milo lost 53% of his original body weight. Now he's a very different dog.
Milo started out, he couldn't even walk around our cul-de-sac. Now he's up to over 2 miles a day. It was just a huge surprise. Milo has a lot of energy. He's much more playful. He's a happy dog.
And what does Milo think of the food?
Milo loves the Hill's Prescription Diet, RD, and he just loves dinner time.
We have rolled years back. We have a dog that is a lot more active, is happier, healthier. I don't think we could have done it without RD.
And Milo's success with Hill's Prescription Diet RD pet food has affected the whole family.
As well as Milo losing weight, I've lost weight. We are all more active, and it's really brought us together as a family.
Ask your veterinarian which prescription diet weight control pet food is right for your pet. Hill's Prescription Diet, clinical nutrition to improve quality of life. Another real-life weight loss success story from Hill's. When Denise Asaro, a registered veterinary technician, first met Pumpkin in the clinic where she works, he was in poor health and really needed to lose weight.
He would find a spot and just lay there, and he wouldn't move all day, and he couldn't jump up onto anything.
Denise adopted Pumpkin, and veterinarian Dr. Josephine McGrain recommended feeding him Hill's Prescription Diet MD pet food. It's specially formulated to help cats lose weight, while ensuring that they receive proper nutrition to maintain good health.
The goal was to get him to lose weight, be more active. He loved MD, and there was nothing left on the plate when we were done with it.
Now, 6 months later, Pumpkin has lost 42% of his original weight.
He's moving around great. He runs up and down stairs. He's happy. Denise is happy. She has a cat that can move. I mean, he was sluggish and unhappy and having health problems from his weight, and now he's not. He's healthier. He loves to be walked on his harness, and before he would never do that. He can do everything a normal cat can do. He's not on any medication. He's got his life back. So now I'm getting to know him all over again. I'm a believer, and the MD works. It's formulated for cats. It truly is nutritious, complete diet that they can lose weight on. I've started many other cats on the same MD to have them lose weight and get a better quality of life. Being overweight is something you can prevent. Animals don't have to be overweight, and by putting them on a prescription diet that can help, that is amazing because you give them back their life.
Ask your veterinarian which prescription diet weight control pet food is right for your pet. Hill's Prescription Diet, clinical nutrition to improve quality of life. Another real-life weight loss success story from Hill's. Michael and Linda Glass knew their English lab, Samson, had a weight problem.
It was very difficult for him to even get up from a lying down position. He was real lethargic.
And he's a very low energy dog, so we became very concerned.
After trying unsuccessfully to help Samson lose weight, they asked veterinarian Dr. Cheryl Chukaski and vet tech Kathy Frid if they could help.
He was very slow moving, didn't play, wasn't very active.
He used to come in here and just plop down.
So we put Samson on prescription RD and started him on his weight loss program.
We could see that Hill's Prescription RD was going to reduce his caloric intake, but secondly, he was going to get all the nutrition that he needed to stay healthy. Based on how fast he ate it, I think he loved it.
Samson's weight loss plan also included getting plenty of regular exercise.
When we first started, he wouldn't trot. He just kind of plodded. As we started to lose the weight, he started to pick up the pace a little bit in his walk, and then he broke into a trot. When that happened, we knew that we were going to be able to achieve this goal, because that was a major milestone.
As the weight started coming off him, he really started to become a different dog.
And after 5 months of eating Hill's Prescription Diet RD pet food, he lost almost 30 pounds, or 23% of his original weight. In addition, Samson's waist measurement went from 38 inches down to 17¼ inches.
He was able to move around more. I can't believe what a difference it made.
And he's much lighter on his feet. And we see him frolicking with other dogs in the neighborhood where before he had absolutely no interest into them at all.
Samson's weight loss and his exercise routine have affected the whole family's quality of life.
I was absolutely shocked to find out that we were losing weight too, and then we thought, hey, this can benefit not just Samson but us. And the time that we spend together is much more beneficial, with Samson being able to be with us everywhere we go.
Now, all we get now is compliments of how good he looks, and that is really rewarding.
Ask your veterinarian which prescription diet weight control pet food is right for your pet. Hill's Prescription Diet, clinical nutrition to improve quality of life.
Most of us understand that daily attention to our teeth and gums is essential for our health. What we may not realize is that our pets also need regular dental care too. Imagine the condition of your teeth if you hadn't brushed your teeth in the last few days, much less the last few months. In this program, we will explore how to provide the best possible dental care for your dog or cat. Your pet is at risk for many of the same dental problems we might encounter. But because your dog or cat may not communicate the pain or discomfort associated with such dental problems, these conditions may go unnoticed or untreated. By applying some of the information you will learn in this short pet care video, hopefully you can improve the quality of your pet's life. And isn't that what it's all about? Let's get started with some facts about pet dental care. Did you know that 80% of all dogs and cats over the age of 2 have some form of dental disease? In fact, all dogs and cats need periodontal care to prevent or treat periodontal disease. So how do you know if your pet is suffering from some form of dental disease? As a pet owner, you might initially recognize persistent bad breath. You may notice a change in eating habits. Your pet may drop food when she's eating, or he may drool abnormally. A closer examination of your pet's mouth may reveal bleeding or inflamed gums, a brownish tartar forming on the teeth, or you might observe soreness around the teeth and gums. Due to the chronic infection in your pet's mouth, you may notice differences in your pet's behavior, such as changes in eating habits or less energy. Any of these signs may indicate it's time to talk to your veterinarian about your pet's oral health. Did you also know that dental disease, specifically periodontal disease, is the most common disease affecting adult dogs and cats? Not only does periodontal disease create bad breath and tooth loss, but periodontal disease also contributes to other life-threatening diseases. The bacteria and inflammation associated with plaque, tartar, and dental disease may damage your pet's heart, liver, and kidneys, potentially causing serious, even fatal health problems. These dangers can be prevented, and your pet can live a longer, healthier life with these simple steps. The first step is to consult your veterinarian. He or she will be able to assess your pet's oral health and make appropriate recommendations. Even if your pet's mouth looks healthy, your veterinarian will be able to recommend the appropriate combination of professional dental cleaning and home dental hygiene to control plaque and tartar accumulation and help keep your pet healthy. If your pet has periodontal disease, your veterinarian will arrange a time to carefully remove disease-causing tartar and plaque from your pet's teeth and gums. The final outcome not only restores your pet's clean teeth and fresh breath, but the risk of related diseases decreases as well. These procedures are very similar to human dental cleanings and should prevent severe problems from arising. Your veterinarian will also thoroughly assess the health of the gingiva or gums and the underlying supportive bones. The time to stop periodontal disease is before it has done irreversible damage to the teeth, gums, and underlying bones. The professional dental cleaning is just the beginning of good oral care. Your veterinarian will likely recommend steps to retard the future development of tartar and plaque. Excellent oral health is maintained by daily oral hygiene, whether by brushing or chewing. A home oral care program may involve regular home brushings, as seen here. In addition, research clearly indicates that the right food can also play a significant role in retarding future plaque and tartar buildup and dental disease. Innovative foods, such as Hill's Prescription Diet TD for dogs and cats, actually works to create a brushing action on your pet's teeth every time they eat. Hill's Prescription Diet TD for your dog or cat is like an edible toothbrush, providing the daily nutrition your pet needs with effective dental care. The larger kibble in Prescription Diet TD doesn't immediately shatter in your pet's mouth, ensuring a longer chewing action. As your pet chews, the entire surface of each tooth is gently scrubbed by the patented fiber matrix. If you are not able to effectively brush your pet's teeth every day, TD provides the dental care your pet needs in the convenience of daily feeding. As you can see by these pictures taken after a 6-month period, the teeth on the dog fed Hill's Prescription Diet TD were much cleaner and the gums were much healthier compared to the dog fed the grocery pet food. Hill's Prescription Diet TD has earned the Veterinary Oral Health Council seal of acceptance for tartar and plaque control, providing you the assurance that TD delivers the dental care your pet needs. With Hill's Prescription Diet TD, you can give your pet superior dental care every day by feeding a great-tasting, nutritionally complete pet food. And finally, be sure your pet continues to get regular dental checkups from your veterinarian. Just as twice-a-year dental checkups are important for people, so are regular dental checkups for your pet. Your veterinarian and Hill's Pet Nutrition are committed to the health and nutrition of your pet. Hill's makes it easy and affordable to feed the very best to your dog or cat. Hill's is so confident in your satisfaction with Prescription Diet TD and all its foods that they offer a money-back guarantee if you're not 100% satisfied with the quality, consistency, or taste of any prescription diet product. Choosing the right food is an important key to achieving and maintaining excellent oral health. Ask your veterinarian if Hill's Prescription Diet TD is right for your pet. Your pet will thank you.
In this program, we will explore common problems associated with gastrointestinal disease in pets and how you, as a pet owner, can help manage the clinical signs commonly associated with gastrointestinal disease, such as vomiting or diarrhea. So let's get started with some facts about gastrointestinal disease in dogs and cats. Risks associated with gastrointestinal disease are vomiting, diarrhea, dehydration, colitis, constipation, pancreatitis, inflammatory bowel disease. Diarrhea is one of the most frequent complaints from pet owners to their veterinarian. An estimated 2.3 million dogs and 2.6 million cats are seen annually for vomiting or diarrhea at veterinary hospitals nationwide. These conditions are very serious and can result in death if left untreated. Early medical and nutritional intervention is critical. The good news is that many of these gastrointestinal conditions respond to early dietary intervention. Early detection starts at home. Look for clinical signs such as vomiting, diarrhea, straining or inability to defecate, blood or mucus in the feces. If you observe any of these clinical signs, you should contact your veterinarian immediately. Contributing factors to gastrointestinal disease include food. Digestive upsets can be caused by poor food quality, food intolerance, high fat, sudden nutritional changes, or overeating. Breed. Certain breeds of dogs, such as Golden Retriever, German Shepherds, Great Danes, and Collies, are more prone to gastrointestinal disorders. Age. Colitis is more prevalent in pets under 5 years old, while constipation is more likely in older pets. Your veterinarian can help identify the cause of gastrointestinal disease in your pet. Your veterinarian will provide information to help you understand the disease and give your pet the best home care. With a few changes in lifestyle and nutrition, most pets with gastrointestinal disease can lead normal lives. Veterinary supervision, proper care, and proper nutrition can help your dog or cat recover and lead a normal life. Gastrointestinal disorders may require a food that is non-irritating to the digestive tract and highly digestible. For over 50 years, veterinarians nationwide have recommended Hill's Prescription Diet ID to help your pets feel better sooner. Hill's Prescription Diet Canine ID and Hill's Prescription Diet Feline ID have been specifically formulated to have highly digestible protein, carbohydrates, and fat that decrease the workload of both the pancreas and intestinal tract. A unique mixed fiber source supports proper intestinal function. All this in a food with the appropriate level of nutrients for long-term feeding of your pet. Some simple home care tips can include 1. Feed only the food recommended by your veterinarian. 2. No table scraps. 3. Don't allow your pet to scavenge. 4. Never use over-the-counter medicines unless recommended by your veterinarian. 5. Speak to your veterinarian before changing your pet's food or medication. Managing your pet's condition is one of the best ways to help ensure they'll be around for years to come. Hill's makes it easy and affordable to feed the very best to your dog or cat. Hill's is so confident in your satisfaction that they offer a money-back guarantee if you're not 100% satisfied with the quality, consistency, or taste of any prescription diet product. Your veterinarian and Hill's Pet Nutrition are committed to the health and nutrition of your pet. Choosing the right pet food is the key to achieving and maintaining your pet's health. Choose Prescription Diet Canine ID or Prescription Diet Feline ID and see the difference it can make. Your pet will thank you. In this program, we will explore common problems associated with kidney disease in pets and how you as a pet owner can help manage the clinical signs commonly associated with kidney disease. So let's get started with some facts about kidney disease in dogs and cats. The kidneys filter and remove waste material from the blood and help regulate body fluids. Kidney disease occurs when the kidney fails to perform these functions properly. Kidney disease is one of the most common medical problems of older pets. Affecting over 1 million pets each year, kidney disease is a leading killer in both dogs and cats. By detecting kidney disease early, treatment can also be started early. There are many signs of kidney disease that you as a pet owner might notice. Some of these signs are frequent urination or no urination, increased thirst, loss of appetite, poor hair coat, depression, vomiting and diarrhea. It is important to note that by the time these clinical signs are noticed, more than 2/3 of the kidney function has been lost and can never be recovered. Kidney disease is best detected by a simple blood test and urinalysis. Diagnosing the disease in an early stage will help start treatment as early as possible. If your pet is over 6 years old, ask your veterinarian about a screening test for your pet. Some of the most common causes of kidney disease are age, nutritional factors, breed or hereditary tendencies, poison, shock, blood loss, and other diseases. There are 4 stages in the progression of kidney disease. Stage 1. Normal kidney function. As early as age 2, kidney function in pets may begin to slow. Stage 2. Kidney insufficiency. Early warning signs such as increased thirst may begin to appear. Stage 3. Kidney failure. Kidneys cannot eliminate waste efficiently, causing signs of illness. Stage 4. Advanced kidney failure. Severe signs of illness are evident. Once kidney disease develops, it cannot be reversed, but there are ways to slow its progression. Early detection and nutritional intervention can give pets longer, better quality lives. Ask your veterinarian for a kidney screening every year for your pet. If your pet has kidney disease, finding it early will help maximize the length and quality of life for your pet. When detected, careful examination and testing can help determine the severity of kidney disease and the best method of support recommended. An important part of that support is what you as a pet owner can do at home to care for your pet. The first thing is to provide special attention and care for your pet. Next, follow your veterinarian's instructions carefully. Monitor your pet's weight, activity, thirst, and general conditions regularly. Inform your veterinarian of any unexpected changes. Provide free access to fresh, clean water. Feed your pet only the recommended food every day and speak to your veterinarian before changing your pet medication or feeding program. Your veterinarian will recommend your pet be fed Hill's Prescription Diet KD. Hill's Prescription Diet KD is specifically formulated as a nutritional aid for pets with kidney disease. The following characteristics are especially important for your pet: reduced protein, higher amounts of fiber, and low levels of phosphorus. Reduce the kidney workload. Low salt and enhanced fatty acids help slow the progression of kidney disease. Added antioxidants reduce stress on kidneys and reduce cellular damage. In scientific studies, Hill's Prescription Diet KD helped extend the life in dogs and cats with kidney disease. A 2-year university study was conducted for dogs with kidney disease, comparing Hill's Prescription Diet Canine KD to a typical adult dog food. The study showed that Hill's Prescription Diet Canine KD delays in the progression of kidney disease, increase the survival time of the pets, and improves in the overall quality of life of the pets. A recent study involving cats showed that Hill's Prescription Diet Feline KD pet food can also help minimize the clinical signs and increase the survival rates of cats with chronic renal disease. Feeding Hill's Prescription Diet KD will be key in helping you to best manage your pet's condition. Managing your pet's condition is one of the best ways to help ensure they'll be around for years to come. Hill's makes it easy and affordable to feed the very best to your dog or cat. Hill's is so confident in your satisfaction that they offer a money-back guarantee if you're not 100% satisfied with the quality, consistency, or taste of any prescription diet product. Your veterinarian and Hill's Pet Nutrition are committed to the health and nutrition of your pet. Choosing the right food is the key to achieving and maintaining your pet's health. Choose Hill's Prescription Diet Canine KD or Hill's Prescription Diet Feline KD and see the difference it can make. Your pet will thank you.
Remember the 5th of November. I love fireworks and I think they're really exciting, but cats and dogs are sometimes scared of them. My cat tries to hide when she's worried, and my dog hates the loud bangs.
In our house, we plug in Feliway for the cat and DAP for the dog a week or 2 before bonfire night. It really helps your pets to relax and feel safe in your home.
Brilliant!
Feliway and DAP. Ask your vet now for advice or visit secrettohappypets.com.
In this program, we will explore common problems associated with dermatological conditions in pets and how you as a pet owner can help manage the clinical signs commonly associated with this condition. So let's get started with some facts about skin disorders in dogs and cats. Skin disorders are the most common reason for patient visits to veterinary hospitals. An estimated 8 million dogs and 3 million cats suffer from skin disorders annually. Skin disorders can take many forms and may be associated with a wide range of allergic and inflammatory dermatological conditions such as adverse reactions to food, atopic dermatitis, flea allergy dermatitis, contact dermatitis, otitis externa, feline eosinophilic granuloma complex. Hill's Prescription Diet DD foods are specially formulated as a nutritional aid for pets with a wide range of inflammatory skin conditions. A clinical study shows that after feeding Prescription Diet DD pet food, pet owners saw improvement in their pet's skin and coat in as little as 4 weeks. And Prescription Diet DD foods feature increased levels of essential fatty acids to nourish the skin and added antioxidants to help support the skin barrier. Your veterinarian may recommend Prescription Diet DD to help provide your pet relief from many common skin disorders. Let's focus on food allergies or intolerances, referred to as adverse reactions to food. This condition accounts for 10 to 20% of allergic responses in dogs and cats. As a general rule, food allergens are proteins. Allergic reactions occur when an offending protein triggers the pet's immune response. Histamine and other compounds are released, causing signs associated with food allergies, such as skin itching and redness, gastrointestinal problems, hair loss, chronic ear infection, diarrhea, vomiting. Factors that can cause or increase the risk of adverse reaction to food include certain types of food or food ingredients, poorly digested proteins, damage to the digestive tract caused by inflammation, infection, and surgery. Certain breeds of dogs and cats are more likely to develop food allergies. Once your veterinarian has diagnosed your pet's condition, a medical and nutritional treatment will be prescribed that will best care for your pet. Nutrition plays a critical role in managing food allergy conditions. Your veterinarian will recommend one of 2 nutritional options to assist you in managing your pet's condition. The first option is to use a food that utilizes the latest innovation that uses the process of hydrolyzation to break up protein molecules to a size that doesn't allow an allergic response. The food your veterinarian will recommend is Hill's Prescription Diet Canine ZD or Hill's Prescription Diet Feline ZD. Both of these products are available in both dry and canned formulas to allow more options in managing your pet's condition. Besides providing the latest technology in hydrolyzed protein, Hill's Prescription ZD foods are also enhanced with antioxidants to help support the skin barrier, have increased levels of omega-3 fatty acids to help reduce inflammation, designed for long-term maintenance feeding. The second option is a food with novel proteins. Novel proteins are proteins that your pet has never eaten. Utilizing novel proteins reduces the likelihood of a food allergy with your pet. Your veterinarian may recommend one of many Hill's Prescription DD foods, which contain one of the following novel protein ingredients: venison, duck, rabbit, salmon, egg. Hill's Prescription Diet DD brand pet foods with enhanced levels of fatty acids and antioxidants have been clinically tested and offers a wide range of great tasting nutritional solutions with canned and dry formulas for dogs and cats. Your veterinarian will provide information to help you understand your pet's condition and give your pet the best home care. With a few changes in lifestyle and nutrition, most pets can lead normal lives. Other home care advice includes: only give your pet food recommended by your veterinarian. Do not feed any table scraps. Provide free access to fresh water. Speak to your veterinarian before changing your pet's medication or feeding regimen. Veterinary supervision, proper care, and proper nutrition can help your dog or cat recover and lead a normal life. Managing your pet's condition is one of the best ways to help ensure they'll be around for years to come. Hill's makes it easy and affordable to feed the very best to your dog or cat. Hill's is so confident in your satisfaction that they offer a money-back guarantee if you're not 100% satisfied with the quality, consistency, or taste of any prescription diet product. Your veterinarian and Hill's Pet Nutrition are committed to the health and nutrition of your pet. Choosing the right food is the key to achieving and maintaining your pet's health. Choose Hill's Prescription Diet ZD or Hill's Prescription Diet DD and see the difference it can make. Your pet will thank you.
Do you know the number one reason cat owners bring their cats to the veterinarian? The answer might surprise you, but the clear leader is inappropriate urination outside the litter box. This, as you might guess, creates quite a bit of frustration with owners, and if left unresolved, often escalates into a fractured relationship between the cat and his or her owner. If no resolution comes about, the cat is often surrendered to the local animal shelter. This cycle is unfortunate, but it occurs all too often. Is your cat at risk for developing a urinary tract disease that might result in inappropriate urinary behaviors? Is your cat trying to tell you something with his or her odd behavior? Due to new advances in veterinary nutrition and a better understanding of veterinary behavior, there is great hope for all cats. In this video, we'll give you insight into understanding why cats urinate inappropriately and how to prevent it. Though behavior can be a primary cause for cats to urinate outside their litter boxes, a surprisingly high percentage of these cases have a clear medical or nutritional cause that can often be effectively treated if accurately diagnosed by your veterinarian. Unfortunately, it's often not as simple as giving your cat a pill. Infections are very rare in cats with urinary problems. Therefore, antibiotics are not usually the answer. Let's join Miss Olson and Dr. Thomas as they discuss Tigger's inappropriate urinary behavior.
Well, Ms. Olson, we've finished all of Tigger's tests and we've ruled out stones and infection as the cause of his problems. I'm pretty confident in diagnosing with what we call feline idiopathic cystitis, or FIC. That would account for all of the symptoms that you described that you're seeing at home, the frequent trips to the litter box and the straining, the crying, the blood that you saw in the urine, and the frequent licking and cleaning himself.
I'm not sure I've heard of the FIC. What is it and how did Tigger get it?
Feline idiopathic cystitis is very common among cats. However, it's one of those disease complexes that's not entirely understood. Okay. We do know that stress plays a role, and diet is very important in both therapy and prevention.
Is it serious?
It really is. There's a lot of inflammation that's going on in Tigger's bladder and his lower urinary tract, and that gives rise to a lot of pain and discomfort, which is giving rise to the signs that you're seeing, the crying, the frequent urination. It can also lead to long-term behavioral changes if it's not treated. Tigger might end up learning to go in other places and other locations besides the litter box.
I had no idea this was going on. Now, you mentioned diet earlier. Does it have something to do with what I'm feeding him?
I'm afraid so. What are you feeding him currently?
Well, it varies. Usually name brand foods from the grocery. I do know in the past I've fed some of the ones that were labeled to help prevent urinary disease.
Unfortunately, most of the diets or foods that you would purchase from the grocery store don't have the proper blend of ingredients and formulation to effectively manage all of the elements of urinary tract disease. Some of those that are labeled for urinary disease that you've used would address pH, and that will help with the formation of what we call a struvite crystal. However, there are other elements that it doesn't take care of. I'm going to put Tigger on a great new diet from Hill's. It's called Prescription Diet CD Multi-Care. It's going to take care of struvite and oxalate crystals, as well as the FIC symptoms that he's currently dealing with. It also is formulated with fish oil, which has omega-3 fatty acids. That's going to be important for breaking that inflammation cycle that he's got going and help Tigger to feel better faster.
Hill's understands the nutritional needs of cats. That's why more veterinarians recommend Hill's Prescription Diet than any other food for managing urinary problems. Hill's Prescription Diet CD Multi-Care Feline has just the right mix of ingredients to minimize excess quantities of magnesium, phosphorus, and other minerals responsible for forming crystals and stones in the urine. This amazing food produces an ideal urine pH and is low in salt. Foods containing excessive salt can promote the progression of renal disease even at early stages before it is even diagnosed. That's important when you consider that kidney disease is one of the leading killers of cats. Hills has also added a unique combination of antioxidants to help reduce cellular oxidation that may occur with inflammatory urinary diseases. Also, the presence of omega-3 fatty acids from fish oils aids in breaking the inflammatory cycle common with urinary problems. Your veterinarian recognizes that other issues sometimes contribute to a cat's inappropriate urinary habits. As a pet owner, you can combine great nutrition with several practical tips that together will make urinary disease less likely. First, know some of the signs of lower urinary tract disease to watch for. Straining while trying to urinate, urinating more frequently, crying out in the litter box, licking around the genital area, lethargy and occasional blood in the urine. Some cats will also exhibit a noticeable change in their normal behavior. Taking other steps to prevent lower urinary tract disease complements feeding Hill's Prescription Diet CD Multi-Care Feline. Plenty of physical activity for your cat is one step that helps lower your cat's risk. Another helpful strategy is to provide plenty of fresh water for your cat to drink. This can be accomplished by providing your cat multiple water bowls that are filled regularly. Another way to increase water consumption is to feed canned foods, which naturally contain increased amounts of water. Prescription Diet CD Multi-Care is available in cans and in many flavors, which may be a convenient option to increase water consumption. Minimizing stress for your cat is also an all-important step that will help in preventing urinary tract disease. You may want to consider creating places to perch away from foot traffic and other pets. Keep the litter box very clean. Many cats will stop using the litter box if it is not maintained by daily removal of feces and periodic changing of litter. Utilize multiple litter boxes. In general, there should be one more litter box in the home than the number of cats. For example, a house with 2 cats should have 3 litter boxes. Most cats prefer clumping unscented litter and an uncovered litter box. It may be helpful to provide several different types of boxes or litter. This makes it convenient for the cat and also allows them to choose between varying litters in varying boxes. In addition, making changes helps break the negative association of pain with the use of the old litter box. Managing urinary disease goes hand in hand with great nutrition. Hill's Pet Nutrition makes it easy with Hill's Prescription Diet CD Multi-Care Feline. Talk to your veterinarian today and see if it's the right food for your cat.
In this program, we will explore common problems associated with arthritis in dogs and how you, as a pet owner, can noticeably improve the quality of your dog's life. So let's get started with some facts on arthritis. Arthritis is a progressive degenerative disease that results in cartilage damage and joint inflammation. It affects up to 1 in 5 adult dogs. More than 8 million dogs nationwide have some degree of arthritis. Arthritis is the #1 cause of chronic pain in dogs. The chronic pain associated with arthritis can also bring about changes in your dog's personality, such as acting aggressive or withdrawn. Unfortunately, all of these signs mean a reduced quality of life for your pet. All dogs are susceptible to arthritis, but certain traits make the disease more likely to occur. These include obesity, certain breeds, aging, lack of exercise, and injury or trauma. Your veterinarian can painlessly perform simple diagnostic tests to help determine if your pet may be suffering from arthritis. Some of the most common symptoms that might be indicative of arthritis and the associated pain it causes are limping, difficulty in rising, decreased activity, reduced mobility, and stiffness. If you notice any of these symptoms, discuss them with your veterinarian. Your veterinarian will provide medical recommendations that will help your dog have the least amount of arthritic discomfort. With a few changes in lifestyle, the proper medications, and the right nutrition, many pets with arthritis can live relatively normal lives. Though there is no cure for arthritis, new cutting-edge developments in pet nutrition are giving dogs a new lease on life. A new food from Hill's Pet Nutrition called Canine JD has been clinically proven to reduce pain in dogs with arthritis, help dogs with arthritis walk, run, play, and climb stairs more easily, help improve the quality of life of dogs suffering from arthritis, and most importantly, provide noticeable results in as little as 21 days. How does Hill's Canine JD accomplish these amazing results? Let's start by explaining the condition this way. Arthritis is a vicious cycle that involves physical stress, damage to the tissue around the joints, inflammation, and ultimately joint failure. The science behind Prescription Diet Canine JD is designed to interrupt this vicious cycle. The unique ingredients of this food actually work to turn off genes that cause cartilage damage, help reduce inflammation, and provide building blocks for cartilage repair. All this in a food with the ideal levels and the great taste your dog will love for a lifetime. So if your pet is suffering from arthritis, ask your veterinarian about starting your pet on Hill's Prescription Diet Canine JD today.
We weren't real sure how we could improve it without going through surgery. You would just see a significant limp, and it would just, you'd think that she's going to break her back trying to walk. But now we haven't seen any of that since being on the JD. We've been thrilled. I mean, Gabby has had a lot more energy, seems to run a lot more, wants to play a lot more. Her limp has decreased significantly. She doesn't carry her leg as she once did. A lot more walks, a lot more jogs, because she can do it without having a lot of pain.
I felt that Chandler, being the age that she is, the quality of life had decreased. She had no motivation to get up. She moped around a lot. She didn't play with the kids. It was hard for her to move around. You know, is she going to make it another month? Possibly this was it. She gets up quicker. She just is more ready to go. She just looks generally like a happier dog with a lot more energy. She's back to what she used to be, kind of acting like a pup.
Managing your pet's condition is one of the best ways to help ensure they'll be around for years to come. Hill's makes it easy and affordable to feed the very best to your dog. Hill's is so confident in your satisfaction that they offer a money-back guarantee if you're not 100% satisfied with the quality, consistency, or taste of any prescription diet product. Your veterinarian and Hill's Pet Nutrition are committed to the health and nutrition of your pet. Choosing the right pet food is the key to achieving and maintaining your pet's health. Choose Prescription Diet Canine JD and see the difference it can make. Your pet will thank you.
Does your dog act like this? Or more like this? Many dogs struggle with mobility problems that may be related to arthritis. The signs of reduced mobility include difficulty rising, walking, and climbing stairs. If you've noticed your pet showing these signs of reduced mobility, you're not alone. 1 in 5 dogs over 1 year old has arthritis. It's the #1 cause of chronic pain in dogs. But there is something you can do. A breakthrough in nutrition, Hill's Prescription Diet Canine JD, could mean a happier, more active life for your pet. Just see how Canine JD has helped other dogs.
Kristen Byers' yellow lab, Chandler, is 12 years old and was diagnosed with arthritis. Her veterinarian recommended trying Hill's Prescription Diet JD.
I felt that Chandler being the age that she is, the quality of life had decreased. She had no motivation to get up. She moped around a lot. She didn't play with the kids. It was hard for her to move around. You know, is she gonna make it another month? Possibly this was it.
In addition to all her other symptoms, Chandler just couldn't jump up into Kristen's car for a family trip the way she used to. But after 4 weeks on JD, she can do that and more.
She gets up quicker. She just is more ready to go. She just looks generally like a happier dog with a lot more energy. She's back to what she used to be, kind of acting like a pup.
Eric Grospich's black lab Gabby is only 3 years old. He and his family were very concerned about Gabby's apparent stiffness in her joints and the way she would favor her leg.
We weren't real sure how we could improve it without going through surgery. You would just see a significant limp, and it would just, you'd think that she's going to break her back trying to walk. But now we haven't seen any of that since being on the JD.
At their vet's recommendation, Gabby's been eating Hill's Prescription Diet JD for several weeks.
We've been thrilled. I mean, Gabby has had a lot more energy, seems to run a lot more, wants to play a lot more. Her limp has decreased significantly. She doesn't carry her leg as she once did. A lot more walks, a lot more jogs, because she can do it without having a lot of pain. And so I think her quality of life has definitely increased significantly. We suggested JD to a couple of our friends whose dogs have had surgery and are still having some limping issues. And so they're going to give that a shot and see if they can have the same effects that we had with Gabby.
Hill's Prescription Diet Canine JD harnesses the natural power of nutrition, using nutrients found in fish oil to reduce inflammation and slow cartilage damage around your dog's joints. In fact, clinical studies show that in as little as 21 days, Prescription Diet JD significantly improves joint mobility and reduces pain in dogs with arthritis. This is just one of the reasons veterinarians trust and recommend Hill's Prescription Diet. Ask your veterinarian if Prescription Diet JD could help your dog have better quality of life. If your veterinarian has already recommended Canine JD, it's important that you follow the feeding instructions every day. That way, your pet can receive the greatest benefit from the natural power of nutrition to improve mobility and the signs of arthritis. Prescription Diet Canine JD is easy and convenient, and dogs love the taste. You don't have to change your feeding routine, just substitute JD for your dog's current food. To get the best results, feed Prescription Diet JD as your pet's only food. Prescription Diet JD is available in both canned and dry formulas to satisfy your dog's eating preferences. For more information about Hill's Prescription Diet JD, talk to your veterinarian or call Hill's Consumer Affairs 1-800-445-5777. Visit jumpfordogs.com to learn more about Prescription Diet Canine JD, see more success stories, and share your own experiences. If you have a friend whose dog shows signs of reduced mobility, please encourage them to ask their veterinarian whether Prescription Diet JD can benefit their dog.
Protecting your dog from parasites is one of the most important things you can do to help ensure long-term health for your pet. And heartworm disease is one of the most deadly threats your dog can face. Heartworm disease is a serious problem. The American Heartworm Society estimates that over 1 million dogs currently have this potentially fatal disease, and more cases are being diagnosed each year, many in parts of the country that are not normally known as hotbeds of heartworm. So let's take a closer look at the heartworm life cycle. Heartworms are spread to dogs through the bite of an infected mosquito. Immature or juvenile heartworms, called larvae, enter the dog's body at the site of the mosquito bite. They then pass through dog's tissue, enter the bloodstream, and make their way to the heart. Once in the vessels near the heart, the larvae gradually develop into adult heartworms. The adult worms will cause the dog serious health problems. In severe infections, the worms can disrupt the heart function and blood flow, and can even damage the dog's lungs, liver, and kidneys. if left untreated, heartworm disease can be fatal. As adult heartworms reproduce, they send more newborn heartworms into the bloodstream. At that point, if the infected dog is bitten by a mosquito, the disease may then be spread to other dogs. The time between the initial mosquito bite and a positive test result for heartworm disease is often more than 6 months. So unless you are continuously administering a monthly heartworm preventative, your dog can test negative, yet still develop heartworm disease. Heartworm disease often doesn't present with many symptoms, so it can be very difficult for pet owners to spot. When symptoms do appear in your dog, they can include coughing, fatigue, and exercise intolerance. Unfortunately, by the time these symptoms appear, it's usually a sign that significant damage has occurred. So what can you do to protect your dog? You can take steps to reduce your dog's exposure to mosquitoes by eliminating standing water where mosquitoes breed. Cleaning gutters, emptying bird baths, and outdoor pet bowls will all help a little. But it's hard to eliminate mosquitoes. They can survive extreme temperatures and reappear when you least expect it. Fortunately, it's easy to prevent heartworm disease. Simply have your veterinarian test your dog annually and give heartworm prevention each month all year round. Preventatives don't kill adult heartworms, they kill the juvenile heartworms before they can grow and reproduce. That's why it's important that your veterinarian tests your dog for heartworms before starting a monthly preventative routine. A positive test result may be an indication that your dog requires more aggressive treatment. And serious health issues can occur in dogs with a pre-existing heartworm infection if they begin a heartworm preventative routine. So follow your veterinarian's advice and have your dog tested for heartworms regularly. To avoid the deadly effects of heartworm disease, your best bet is to start a monthly heartworm routine as soon as you can and stick to it. Dealing with fleas is a very common and annoying problem for pet owners. Chances are your dog will encounter these thirsty little bloodsuckers at some point. These tiny pests can be hard to spot. Fleas can't fly, but they can jump up to 8 inches high, making your dog an easy target. And they can be more than just annoying, they can pose a serious danger to the health and well-being of your pets and family. The saliva from flea bites can trigger an extremely unpleasant skin allergy in your dog. Severe flea infestations can produce blood disorders, especially in puppies or older dogs with other health conditions, and ingested fleas can even cause intestinal tapeworm infections. So let's take a closer look at the flea life cycle. Fleas live off the blood of their host, whether that's your dog, your cat, or a wild animal. Once a flea jumps onto your dog, it only needs a few seconds to begin feasting. Fleas must feed a lot in order to reproduce. A female flea consumes 15 times her body weight in blood every day. Once she's made a meal of your dog, she'll start laying eggs in less than 48 hours. Female fleas produce 40 to 50 eggs a day, and they usually lay their eggs right in your dog's hair. Many of these eggs will fall off your dog, spreading the infestation all over your home and yard. Flea larvae, which are similar to maggots, hatch in just 1 to 6 days. At this stage, they like to live deep in carpeting or under furniture. Outside, they develop best in shaded areas or in yard debris. The larvae build a cocoon to help them grow and mature into adults. The adult flea can emerge from the cocoon in just 13 days. However, a fully developed flea can remain inside the cocoon for nearly a year, which is why infestations can sometimes pop up out of nowhere. Once out of the cocoon, adult fleas begin searching for their next meal, and the whole itchy cycle begins again. Most people don't realize that in many areas, adult fleas can survive throughout the winter on pets and wildlife, so the threat never truly goes away. If your dog is showing signs of excessive scratching, check his skin and coat for the presence of adult fleas. Using a fine-tooth comb can help, and also look for signs of flea dirt, the dried blood and waste left behind after a flea feasts on your dog. If you find evidence of fleas on your dog, it's important to take action right away. Fleas reproduce so quickly, you'll want to fight back before the infestation has a chance to grow. There are many different types of flea treatment options available. Talk to your veterinarian about which one is right for your dog. If your home is already infested, you can help eliminate flea eggs and larvae by steam cleaning your carpets and upholstery. washing all bedding weekly, and using flea sprays as recommended by your veterinarian. If you have other pets at home, ask your veterinarian to recommend an approved flea product. The best way to fight fleas is to kill them before they can reproduce. So talk to your veterinarian about how a monthly parasite protection routine can help keep fleas off your dog all year round. Dogs have a nose for adventure, but sometimes they can get into trouble without even knowing it. Intestinal parasites, or worms as most people call them, are a common and widespread danger to your pet. It's important to distinguish intestinal worms from heartworms. They are two completely different things, and dogs get them in very different ways. Here, we're talking about intestinal worms that infect your dog's digestive system. Dogs get intestinal parasites in one of four ways: by ingesting worm eggs or worm larvae in feces or infected soil, ingesting raw meat or remains of an animal that has been infected, by becoming infected by worm larvae puncturing the skin, as is the case with hookworm infection, or directly from their mothers, either while she is still pregnant or through her milk. The larvae migrate throughout your dog's body before attaching themselves to the intestinal tract, where they grow into adult worms that feed off your pet and cause significant health issues. Dogs with intestinal parasites can suffer from diarrhea, dehydration, blood disorders, inflammation of the large intestine, and coughing. Worms can cause weight loss in adult dogs and failure to thrive in puppies. In severe cases, intestinal parasites can be fatal. Some of the most common intestinal parasites are roundworms, hookworms, and whipworms. Let's take a closer look at the life cycles of these three dangerous parasites. Roundworm eggs can be found in dog feces, infected animals, and animal remains. The eggs can remain in the yard even after the initial source has disappeared. Dogs ingest the infected eggs. After hatching, the immature worms usually pass through the dog's liver and lungs and settle into the dog's intestines, where they mature into adults. From there, adult roundworms lay more eggs, which are passed through the dog's feces back into the environment. Dogs can get hookworms through animal feces, small infected animals and insects, or when hookworm larvae penetrate the dog's skin. When a dog becomes infected, the larvae move to the small intestine, where they mature into adults. Sometimes they move into the lungs or skeletal muscles, where they remain dormant until migrating through the intestinal tract. Hookworms can live up to 2 years, feeding off your dog's blood and the walls of his intestines. Finally, dogs get whipworms by ingesting the worm larvae present in the environment. Whipworm eggs can remain viable in the soil for many years. Once inside the intestines, the worms take approximately 3 months to mature into adults. Once this occurs, adult whipworms live in the dog's large intestines and only shed eggs intermittently. However, female whipworms can produce up to 2,000 eggs each day. So how do you know if your dog has worms? Your veterinarian will test your dog's stool for worm eggs at his yearly checkup. Other signs to watch for include coughing, vomiting, diarrhea, especially if there's signs of blood, worms in his stool, lethargy, an appearance of a pot belly, weight loss, dull coat, or scooting his bottom across the floor. Only veterinary tests for intestinal parasites can provide an accurate diagnosis. So be sure to visit your veterinarian if you suspect your dog may have contracted worms. To reduce the risk of your dog or family coming in contact with worm eggs and larvae, pick up feces immediately when walking your dog and clean your yard often. And follow the Companion Animal Parasite Council's guidelines for fecal testing. Worms are a continuous threat, so ask your veterinarian about effective treatments that can help protect your dog from intestinal parasites all year round. Just 1 dose a month can make a big difference in the health and well-being of your pet. Ask about Trifexis, the combination product that kills fleas and prevents infestations, prevents heartworm disease, and treats and controls hookworm, roundworm, and whipworm infections. See the full product label for complete safety information. Serious adverse reactions have been reported following concomitant extra-label use of ivermectin with spinosad alone, one of the components of Trifexis. Treatment with fewer than 3 monthly doses after the last exposure to mosquitoes may not provide complete heartworm prevention. Prior to administration of Trifexis, dogs should be tested for existing heartworm infection. Used with caution in dogs with pre-existing epilepsy. The most common adverse reactions reported are vomiting, depression, itching, and decreased appetite. To ensure heartworm prevention, observe your dog for 1 hour after administration. If vomiting occurs within an hour of administration, redose.